will be interrupted on a rolling basis, I would guess, for the second vote. Mr. Secretary, thank you. Thank you for testifying before this committee. It's the first time in front of our committee since you were sworn in, confirmed as the Secretary of Veterans Affairs. And I thank you for your acceptance of my invitation and your willingness and the ease with which you agreed to come before the committee at the appropriate time. While the VA is operated by many hardworking and caring staff members, many of whom are veterans themselves, the bureaucracy of the VA has hampered some of the department's successes. The current way of doing business at the VA is not always working for every veteran or military family. I hear from Kansans, as I assume we do as members of Congress. We talk to Kansas veterans regularly. We talk to their loved ones, as well as Kansans who work for the VA in the medical facilities, the regional offices, the veteran cemeteries, about the challenges that they are facing. I look forward today to hosting you in Kansas and sometime in the near future where we will visit those veterans and those VA employees. This committee has worked to improve the VA, to improve its services for millions of men and women around the country who rely upon the health care benefits and services that the VA provides. Most of the time, we've done that in a bipartisan way, and we've made progress. The Mission Act made the VA care more accessible and enabled veterans, particularly those in rural areas, to receive care closer to home. The Mission Act improved what we started out as the Choice Act. The PACT Act expanded health care and benefits to millions of veterans who were exposed to burn pits and other toxins during their military service. Yet, as we always say in this committee, more work remains to make this agency, this department, the second largest bureaucracy in the federal government, perform to the levels that veterans, their families, and VA staff members deserve. I believe that we share many of the same priorities, Mr. Secretary, including eliminating waste and reforming the VA to better serve nation's veterans. During the last 3 months, there have been announcements about significant changes across the department, including employee terminations, contract cancellations, and plans for large-scale reductions in force that could see the VA return to the top-line workforce numbers in place 6 years ago. That has caused understandable concern among veterans and VA staff, as well as many of us here on the dais. Mr. Secretary, I look forward to you addressing those concerns this morning. I think how this process is completed or how this process occurs is hugely important. And I have told you on the phone that it ought not be a set number that you're trying to reach. It ought to be about right-sizing the Department of Veterans Affairs. The department is at a critical juncture. Perhaps that's always true. And I want to hear from you that the changes underway at the VA are backed by data, informed by veteran demand, focused on improving outcomes for men and women that the VA serves, and will be carried out in close coordination with this committee, as well as with veterans, VA staff, and veteran organizations. As the VA undergoes restructuring, the department must be well-staffed by a quality, accountable workforce, and any efforts to right-size the workforce must be done carefully in a manner that treats men and women who entered public service to care for veterans with gratitude and respect. I believe that we can work together to achieve lasting and positive changes at the VA that best serves our veterans, staff members, and survivors, done in a way that is the right way to do it. Mr. Secretary, I indicated that in one of our last conversations that if you are right-sizing the Department of Veterans Affairs, whether the numbers go higher or lower, that's not the issue. The issue is about the right size for taking care of those who served our country. I thank you for being here this morning, as I said earlier, and with that I yield to the ranking member, Senator Blumenthal, for his opening remarks.
Thank you, Mr. Chairman, and I want to thank you, Senator Moran, for, again, bringing us together, for the bipartisan work that you and I have done together. This committee has been more bipartisan than any in the United States Senate, so far as I'm concerned, and it will continue to be so in championing measures like the PACT Act, which Secretary Collins, by the way, I just noticed, is not mentioned once in your written testimony, which mystifies me. Let me say at the very outset, I'd like to enter a few items into the record. The first is an article published this morning by ProPublica, supported by hard evidence and in-depth conversations with VA staff. It outlines a number of examples of real-life impacts to veterans caused by the firings, freezes, and cuts in this administration. It also outlines disturbing warnings of what's to come, documents with recommendation from DOGE, the DOGE tech boys, I call them the DOGE dopes, that outline cutting 100,000 employees and closing as many as 17 VA hospitals. I'd also like to enter into the record a statement from Darren J. Pettit, president of the AFG Local 0025. His statement is a summary of the dozens of impact statements from VA employees that were provided to my office this morning. And in addition, the New York Times article on mental health care, diminishing and degrading privacy available through telemental health care that is absolutely unacceptable. In Mr. Pettit's words, his statement represents, quote, the collective voices of frontline public servants who have endured significant and unjustified hardships stemming from recent policy changes, management decisions, and failures to honor basic labor protections. Finally, I want to submit for the record an updated list of 41 requests for information and 19 letters of inquiry that have been sent to this administration without substantive response, any sufficient response, or any response at all. If that is okay, Mr. Chairman, without objection.
Without objection, so ordered.
We're here about accountability, which so far has been totally lacking. The absence of responses to our inquiries are simply unacceptable. You inherited, Mr. Secretary, a VA that was delivering a record amount of health care. Last year, wait times decreased despite a record increase in new patient appointments. You claim the disability backlogs got worse, but the percentage of backlog claims actually is about the same, but increasing challenges in numbers. And the VA has decreased the time to process each claim, setting new records for productivity. You inherited a VA that was setting new records for burials, and that is important to the service members, the families that sadly have to provide those burials. The VA has been delivering more care, more services, more benefits to more veterans, and doing it faster than ever before when you took over. And that is in no way to deny the importance of improvement. Call it reform, call it revision. Improvement is absolutely necessary. But it shouldn't be done with a chainsaw. The head, the commander of the Veterans of Foreign Wars came before us, and he drew this analogy. When he was wounded in combat, the surgeon used a scalpel. He took the shrapnel out of his arm. He did not use a meat axe. He did not use a chainsaw. And that's the kind of improvement that we should work to achieve with the input of those skilled and dedicated caregivers who are working hard in the VA right now, a third of them veterans, thousands of them already fired, and others potentially losing their positions in the future. You've announced the cancellation of 800 contracts worth an alleged $2 billion, only to rescind that statement once the harmful impacts of the cancellations were made public, and we protested. You arbitrarily fired thousands of VA employees, including Veterans Crisis Line employees, only to subsequently reinstate a number of them after public backlash or after you learned that they were fired by mistake, and we protested. You've delayed the opening of facilities across the country only to announce they'd open in phases because of insufficient staffing. You've equated them to restaurants. You claim that's how it's always been done, but that's not true. And so far as that 83,000 number is concerned, apparently you want to go back to the 2019 numbers, because since then, some 80,000 VA workers have been added to the rolls. You should know 2/3 of them are healthcare workers. If you slash those healthcare workers, VA quality and access will diminish. A number of them are VBA claims processors, 1/3 of them. If you slash them, the times for PAC Act benefits will be delayed. I think that oversight is absolutely necessary and improvement is always possible, but it should be done positively without the slashing and trashing that right now you have advocated. In the real world, we know that support personnel are absolutely necessary. Answering the phones, cleaning the surgical equipment, preparing the operating rooms, scheduling the appointments, or fixing the IT systems. Those burdens will fall to others, or they will simply fall through the cracks if you slash and trash the VA. In Connecticut, the VA is operating without a locksmith because that position is not exempt from your hiring freeze. And the VA has ignored local requests for that exemption. There's no way for a VA facility to operate reliably and safely without good locks on the doors. Now, that position may seem like a minor or trivial one, but every member of the VA team is necessary to make the team effective and efficient. Now, we've already begun seeing the results and local impacts of staffing shortages. We've heard directly from veterans. My office has, colleagues have. Service lines at numerous VA hospitals and clinics have been reduced. Mammogram appointments have been postponed. Prosthetic employees have been fired and services reduced. The availability of VA operating rooms, as well as inpatient, recovery, emergency room, and long-term care beds have been reduced. Probationary staff in logistics and procurement have been fired, meaning critical medication and equipment deliveries have stalled. In some VA hospitals, senior and clinical staff are now helping stock supplies. Medical center employees who manage research grant applications have been fired, leaving hospitals unable to apply for new research funding. Countless employees are being driven away. You have 40,000 openings right now that you're recruiting to fill at the same time as you're firing 80,000. It makes no sense. How do you expect to recruit qualified, skilled, dedicated new workers, whether they're physicians or counselors, nurses, when you are firing probationary employees who are the future of the VA workforce or who have been promoted because they are performing with such excellence? Nonsensical. So I think that you owe this committee some explanation. You have refused to do it so far in response to the 19 letters that I have written along with colleagues and the 21 other inquiries. There needs to be accountability. We need to avoid the potential disaster that is looming. And make no mistake, it is a disaster that is on the horizon, approaching us as surely as a thunderstorm in the nation's capital. And we need to avoid it. It will be a self-inflicted wound that disastrously affects all of our VA beneficiaries, whether they use health care or the PAC Act. And that is one reason why I have advanced the Putting Veterans First bill that would mandate rehiring all those fired VA employees and all the veterans who've been fired from the federal workforce in other agencies, give them the right to individual personal determinations, which should be their right under current law. We need to make the VA a place that works better for veterans and their families. They deserve nothing less. Thank you, Mr. Chairman.
Senator Blumenthal, thank you. Mr. Secretary, we now recognize you. Thank you for your presence, and we recognize you for your testimony.
Thank you, Mr. Chairman. I appreciate that. And Ranking Member Blumenthal, distinguished members of the committee, it's good to be back here.
Secretary, would you pull the mic closer, please?
It's on, and I'm
that is better.
So I'm gonna have to swallow it. Okay. There we go. All right. Since becoming VA Secretary, I've met with men and women who show up every day to work. It's been one of the greatest experiences of my life to see the deep dedication that they have to the veterans that they serve. And I've also listened to those VA employees and others who have expressed their concerns about what is going on and the stuff that they need to be able to do to perform their job. Most of those are a bureaucracy that has been out of control and a bureaucracy that has not been tamed in years. You know, also, though, in the same period of time, since I've come to learn what many of you on this committee, the VA is needed to reform, in which I could probably quote almost every member of this committee who has stated in the past multiple times, including even last year, that the VA needed reform and needed it badly. We must do a better job serving our veterans and getting to yes with veterans to the benefits that they have earned, and making sure the money Congress appropriates to the VA is not diverted to non-mission critical or even wasteful programs. Way back in 2024, Congress discussed many times reform in the VA, but it often was simply a thinly veiled quest for more employees. But the Department's history shows that adding more employees to the system doesn't automatically equal better results. Just the Biden administration, the perfect record, the last 4 years, which again, I'll be happy to talk about today, showed that this issue of money and people do not solve the problems. In fact, the number of VA employees grew by more than 52,000 full-time equivalents from FY21 to FY24. And did all those people make things better for veterans? No. In fact, VA performance actually got worse. VA wait times for primary care rose from 15.7 days to 24.3 days. Wait times for mental health care rose from 14.7 to 20.4. Wait times for specialty care rose from 24 days to 38 days. And VA disability benefits backlog increased and was at 260,000 when I took office at the 1st of February. I will say that we have decreased it by 40,000 since we've taken office. Something has to change, and we're going to have to change it. President Trump looked at the problems. He's looked at the problems across it and said, let's take care of our veterans and do so in a way that takes care of our veterans, families, caregivers, and the survivors that we serve. And also, I've never been shy about talking about and addressing tough issues, and I won't ignore the elephant in the room here today. As has already been discussed, and we're aware, we're looking at department structure and staffing across the enterprise. I've said countless times, this review is aimed at finding ways to improve health care and benefits for veterans without cutting care and benefits for veterans. Our goal is to increase productivity, eliminate waste, bureaucracy, increase efficiency, and improve health care to benefits and our veterans. We're going to maintain VA's mission-essential jobs like doctors, nurses, claims processors, while phasing out non-essential roles like interior designers and other things. DEI. This is savings we can achieve that will be redirected to veteran health care and benefits. Our goal, and here is the key word, our goal, as we look at it as everything goes forward, is a 15% decrease. It is a goal. If it's, as the chairman said, it could be less, could be more. It is a goal that you have to look at. You have to start somewhere. Year after year, the calls for VA reform come from every corner. The lawmakers, media, watchdog groups like the Inspector General, Government Accountability Office, VSOs, individual veterans across the country. This year, we have finally embarked on a historic effort to reform the VA. We have been emphatic that we will not be cutting benefits and health care, only improving them, and I think the budget shows that. and we're engaging in career subject matter experts, senior executives, political leadership to restructure the department so that it works better for veterans. A scalpel, not a hatchet. We are also doing what all the veteran stakeholders agreed needs to be done. And there has been some reaction. We've been met by a barrage of false rumors, innuendo, disinformation, speculation, implying firing doctors and nurses and forcing staff to work in closets and showers, and that there's chaos in the department, none of which have been backed up, even articles from today. Why? Because we canceled some contracts that work for the VA that we should be doing in-house, and we let go less than 0.5%. That's why I'm sort of amazed at something you just said, that we've had let go 0.5% of non-mission critical employees. Do I hear our critics tell it? The department was absolutely perfect before January 2025. Everyone knows that's not true. The fact is that the VA healthcare has been on the Government Accountability Office high-risk list for a decade. GAO says VA faces system-wide challenges in overseeing patient safety, access to care, hiring critical staff, meeting future infrastructure needs, and we're working hard to fix these and other issues, and we need your help. We want to work with Congress to fix the VA. But our shared goals need to be making things better for the veterans, not protecting a department's broken bureaucracy. The Department of Veteran Affairs is not a federal jobs program. It is an organization whose sole purpose is to serve veterans, and we must never lose sight of that. In just the first 100 days, we refocused our core mission back on the veteran, not the VA itself. We're making sure that they actually get choice in the Mission Act, which is what the law requires, which we have found over the past few years has been actually stifled at the VA. Instead of sending people to community care, they were actually encouraged and fought to stay in the care, inside the VA. We brought back people from work. We've accelerated the deployment of our electronic health records management system. And yes, we have processed record numbers of disability claims and redirecting millions of dollars from non-critical efforts to support our beneficiaries. As we go forward, we're just getting started. There's a lot that we can agree on. There may be some things that we disagree on. But the one thing about it, it will never change for me, Mr. Chairman, Ranking Member, and the rest of the committee, is that we have got to take care of our veterans. And obviously the numbers that we've seen in the last few years have shown that we're not. And with that, I yield back.
Mr. Secretary, thank you. So what, in your time as the Secretary and the circumstances that you are under and engaged in, what do you assess as your most significant areas of concern for the VA? And what do you believe is working? Is there anything that you've learned that needs to be done differently?
Thank you, Mr. Chairman. I think one of the most interesting things for me in the first 100 days is constantly fighting rumor and innuendo, much of which I'm sure we will hear today that I'm going to try and put to rest. But one of the things is I had to take it from a perspective of us being on the GAO list and looking at the past history, as I expressed to many of you during confirmation, is what is working right and what is not working right. And as we looked at this, what I found was a system, bureaucracy, that was broken. Here's an interesting stat for most of you that you may not know. I came into the office, and it took me a week and a half before our Human Resources Department could actually produce a list of all the employees that we have. A week and a half, because our systems were so broken and bureaucratically challenged. You know, we didn't address any of the, what I found out was we didn't address any of the major concerns. Wait times, which I just outlined in my opening statement, have gotten worse. Backlog got worse. All while we were adding people and all while we were adding money. You know, the inefficiencies are interesting. I'll just show you one example. Under the previous administration, they were trying to consolidate payroll. And payroll, across the board, we asked for a number from payroll. We got 230,000 as our employee base. It's who we were paying. Well, we know, obviously, we had almost 470,000. The reason is we had 50 to 60 of our hospitals still doing their own payroll instead of it all being centralized where it could be done in an efficient manner and make sure that we all have it where we need to go. The HR system is in disarray. Suicide, our death by suicide number has not changed since 2008, yet we're spending $588 million a year to look at that, and $2.3 billion in counseling and care. These are just the things that we have seen so far, and we've actually implemented to go forward and look at the things that we got to fix and move forward on those. But to simply say that where we came in was okay and needed tweaks was just simply not true, and veterans in this room and other places know that.
Mr. Secretary, you mentioned in your opening statement Inspector Generals. I've
Yes.
indicated, I think, in many conversations and certainly hearings in which VA staff are witnesses, that the return of an Inspector General is a high priority for me. What's the plan?
We're in favor of that as well, and making sure that the White House, and we've encouraged the Inspector General to be named, and look forward to that being in place. I mean, again, we're looking at it as a metric of how we can get better. For the last 10 years, that has been the metric saying that we're at a high risk. So from our perspective, we welcome the oversight to make sure that we're eating the metrics that we need to do to take care of veterans.
And so, Mr. Secretary, your impression that you leave is that the White House, the President needs to nominate someone. Is that where we are?
That is the next step in that, yes.
Okay. I want to ask a specific question.
Okay.
Community care. I appreciate your attention to the Mission Act. We've been trying, this committee, that we believe is particularly important for veterans at risk for suicide and mental health issues, veterans who are potentially victims of overdose deaths. I wrote to the VA in January urging mental health residential rehabilitation treatment programs to be included under existing community care access standards to immediately expand access to those life-saving services to veterans across the country in the community. Can you provide me with an update on your progress to add mental health residential rehabilitation treatment programs to the Mission Act access standards?
Yes, and I think that is going through right now and adding those as we go forward, making sure that the VA and the veteran is going through the programs that have are suitable for the program it needs to be, and also taking care of the needs of the veteran. So that is moving forward. We agree with you that any opportunity that we can take to give more service to the veterans, especially in the mental health area. Also, Mr. Chairman, there's something else to think about here as well. One of the things that I didn't mention earlier is there seems to be at times a difference in how we deal with the VA as opposed to how we deal with healthcare in general. And some of that's frankly needs to change in the sense that the VA is the largest healthcare provider, but also we share the same challenges as the community does as well, with doctor recruitment, nurses shortage, doctor shortages, mental health workers, and those. So we're working those in our areas to make sure that we do have good community health community partners in this regard, and also hiring the best that we can. Also leveraging partnerships with DOD, but also looking at our nonprofits and our VSO to see how they can help as well. So it's a total approach to how we're looking at this, and want to continue to do that.
Blumenthal.
Thanks, Mr. Chairman. You know, I listened to you recite those problems that you encountered. Mm-hmm. Not a single one of them will be solved or addressed by slashing the VA workforce by 83,000 people. Putting those workers on the chopping block fails to address one single aspect of any of the problems that you have brought to this committee or that you encountered. Are you aware, Mr. Secretary, that the VA changed the way it calculates wait times in 2022?
The information I gave you was as of our current VA system.
The information you gave us is deceptive and misleading because the VA changed the way it calculates wait times in 2022. In addition, because it begins in 2021 at a time when a lot of VA patients were coming back to the VA after COVID in 2022. This information is fundamentally deceptive and misleading. I ask you to go back to the VA and correct it in a written submission to this committee. Mr. Chairman, I ask that we enter into the record an article that appeared in the New York Times entitled, "What Elon Musk Didn't Budget For, Firing Workers Costs Money Too." Are you aware, if there's no objection?
Without objection.
Are you aware of the costs that will result from firing those VA workers in compensation that has to be paid to them when they have been wrongfully terminated?
Well, Mr. Chairman, and Mr. Ranking Member, if you look at that from a perspective, there's cost to moving forward. There's been some issues here. I think one of the biggest things—
You don't have a number for us, do you?
No, because we've less than
because you haven't calculated
less
what
than
it will
one-half of
cost
1%
to
of
fire
people we've
those
actually been fired.
workers and then reinstate them when the courts tell you, as they will, that they've been wrongfully terminated.
We're talking about less than 1/2%, Mr. Chairman, Mr. Ranking Member. You've thrown out numbers of thousands. This is exactly what I'm fighting against. When you
It may
use
be a
numbers that
small
are
part
not
of your
true.
workforce, but they are the physicians.
No,
they are the
no,
surgeons.
Mr. Ranking Member, I will not let you do that. I will not let you sit here and scare my veterans and scare my employees, because there's been you must have stuff that, again, you're looking at making a prediction in the future, because no one has discussed firing doctors or firing nurses. We have always said that we're going to keep frontline health care. Now, if we want to continue this message that these are out there when you have no knowledge of what you've just said, except speculation
let's begin with
and
facts
innuendo.
right now.
That is facts.
Will you submit to us, which you have failed to do, specific positions where workers have been fired already?
At this point in time,
Yes or no?
we've submitted to that. You also said something that I need to address real quickly. We have
Well, wait a second.
Yeah,
Please answer my question. Will you give us the information?
We have given you the
We've requested
information
it
that is
again and
required.
again and again. What positions have you terminated, and what's your plan for terminating in the future?
Okay. First off, we will get you the information that our staff will check back with the plans for the future. This is an interesting thing. You would like I think what we're trying to do here is we're going through a process, which I talked about in my opening statement, that deals with career employees, that deals with professional staff, and others outside consultants to see what is the proper size for our VA.
You're running out
let
the
me answer the
clock.
question or
I
not.
know what the tactic is.
Let me
we
answer-
both know, because you served in the United States Congress too. You can fill the air with words.
You
but
can as
what
well, sir.
veterans deserve is action and accountability. We've asked for this information repeatedly. You've said you are firing 83,000 people. If you fire the people who have been hired in the last 5 years, you will be firing physicians, nurses, surgeons, counselors, workers who are front line. You cannot slash and trash the VA without eliminating those essential positions which provide access and availability of health care. It simply cannot be done. And you may give us a lot of verbiage here, but you're not giving us facts, and facts are essential to accountability. That's why you're supposed to be here, but you're not giving us the facts that we need. Thank you, Mr. Chairman.
With all due respect, can I answer his question?
You may answer.
Thank you. With all due respect, there's verbiage being said from the dais as well. And dais that I would like to say, as I have said already in this hearing, that there is a goal of looking at a 15% reduction. You have stated on several occasions already that I'm saying we're going to fire 83,000 employees. That is wrong. I would appreciate that being corrected, because that's not true. I said we're looking at a goal of how many employees we have and how many employees that are actually working in the front line taking care. I have doctors and nurses right now that do not see patients. Is that helping veteran health care?
Yes, it
no,
does.
No, it does
does.
not.
A
Not when I
doctor
need
who
those doctors.
consults on a
Not
case,
when I need those doctors in a
a
clinic.
doctor who consults, a doctor who advises, a doctor who looks at radiology reports, a doctor
you're missing the
who
point.
is overseeing and assuring quality. Absolutely, yes.
Senator Tuberville.
Thank you, Mr. Chairman. Thank you, Secretary Collins, for being here, and thanks to the veterans that are here today. And I want to pass on the thanks from the 400,000 veteran state of Alabama. They have, for the first time in just 2 months, have seen progress at a lot of VAs in my state. We've seen a record number of disability claims processed, employees finally returning to work, and an end to the DEI programs like treatment for gender dysphoria. You know, the days of business, as we all are noticing and hearing today, are over, and finally our veterans are being put first. And let's talk about the budget a little bit, Mr. Secretary. Over the last 10 years, the VA's budget has more than doubled, and the number of employees at the VA has increased more than 100,000. But the number of veterans in our country is declining, and VA enrollment has changed. The VA has become a bloated bureaucracy. I think most of us will agree with that. Secretary Collins, why has the VA budget become so bloated over the last 10 years if the veteran population has remained stagnant?
Senator, I appreciate the question, because there's also one other number that we're leaving out there as well, is that veteran population of actually enrolled in the VA has stayed steady at 9.1 million. No matter, and again, we can try and talk about numbers all we want here, but it's been 9.1 million steady for the last 10 years that we look at this. So we're also losing veterans as a total population, but we're also not gaining in the enrollment of the VA. What we tend to forget, and some people will say, well, we've had an increase in different programs we have, but we also lose about 400,000 veterans a year to death, natural causes. So I mean, it's a priority of function. So what we're looking at here is there's been programs that have been increased, there's been a mandatory spending increase, and those have been the things that we look at. I think what we're actually looking at here, though, is there's been a decision that we want to, that it's easier to just put money and people toward issues without looking at, is there any cost, or is there any real world aspect of that? Is there a return on investment? I think that as you talk to veterans, and I go out and talk to veterans, one of the things that we're having is that those amount of numbers and people aren't equating into how we can actually function. I appreciate the ranking member service. I appreciate we just disagree on this, that when we have doctors and nurses that are, and other clinicians who are not actually, being clinicians and not reading, charts or doing anything else, they're actually, formulating policy or doing administrative work. When I have, these many folks that need to be more in the clinics, then we're not helping the veteran. That's just something that's not happening. When you're taking time to process disability claims that went up, then also not having the proper, computer, the AI technology to help us and do that, but also putting out the issues that are slowing up. And then also we get in our own way because we're such a bureaucratic organization. We have rules over rules over rules. I had a gentleman tell me just the other day, and this is, again, I've seen this before from my own daughter. He actually said that he was a double amputee. He actually said, I have to go to the VA. If I need a new wheelchair, I have to go to my primary care, a PT, and an OT before I can get a seating clinic appointment. Explain to me why we're having to go through that kind of mess to get straight to a seating clinic, which we know where they need to be to start with.
Thank you. I often hear a lot about the large amounts of paperwork and administrative burden VA doctors are forced to navigate when seeing patients. This leads to VA doctors seeing less patients per day. Where do you see the opportunity to reduce all these administrative processes?
I think there's plenty of opportunities there. And again, this has nothing to do with employees, has nothing to do with money counts. It's just simply, are we doing it most efficiently in the process? I've made a statement to every hospital that I go to, every clinic that I go to, every veteran benefit office that I go to say this: tell me what is, if you had, I use a proverbial 10 sheets of paper. If you have 10 sheets of paper to get a veteran the services that they need, or 10 sheets of paper to do the next thing, can you do it with 5? I mean, I'll show you an example. To apply for benefits in our VBA, there's a sheet on there that that is on there that has a full listing of the veteran as far as just basic information about their military service. And this, for older veterans, could be a problem actually to go back and remember dates. If the veteran served, then we could use that with their name, their social security number, their DOD, or their ID number, using their DD-214. We can gain all the records that we need to confirm that they're a part. But yet we're making them go through this process of filling out a form that many of our veterans who may or may not have computer capabilities are having trouble with. So it makes it difficult.
I hear from some of the supervisors in the VAs, and they say we use 2 coding systems. One hospital coding system that is very, very effective, and the other one is from the WHO, which is a useless piece of crap. This comes from them. Why don't we use both of those?
That's something I'm looking at now, again, to try and streamline the issues that we have in our system so that we, again, it is interesting. A lot of times we end up talking about processes and plans here and not talking about actual care and actually what the veteran experiences when they go in. Most of the veterans, I will tell you, a lot of times they actually when they get through the labyrinth of stuff to get there, they're happy with the service that they get. They're glad that they're getting the service, and they appreciate that. They enjoy the choice. But when we actually put restrictions on our employees and put restrictions on veterans getting in, it just makes it all the worse.
Thank you.
Thank you. Senator Murray.
Thank you, Mr. Chairman. Secretary Collins, thank you for being here. Thank you for taking the time to talk with me yesterday morning about the new policies that you now have related to congressional engagement. For all of my colleagues, this new policy will limit our ability to interact with veterans on a VA campus, as it did when I was denied the ability to host a veteran and provider roundtable at the Seattle VA. I'll note I have done that many times over over 30 years here in the Senate. My staff was told it was a new policy, which had not been put into writing at the time that I got denied, and I just want to reiterate my request, Mr. Secretary, that you share that newly written policy with every single member of Congress.
Hey, Senator, we definitely, as you and I talked yesterday, this had been an unwritten policy for years. It had been basically, it had been applied differently, and I think that I went back and checked it. It had been applied differently, and simply there's no filter that we want you to have it
I
be
just
there.
have to say, I've never been denied before.
That's
I don't
fine.
know anybody else who has.
Yep.
This is a new policy, and I think it's important that you have
will
it
be.
in writing to every single
will be.
member, so we all know that. I'd also note that in our conversation yesterday, as well as in your responses to nearly all of the oversight letters I've seen, you are relying on this very broad explanation to everything that, and I quote it, "Everything you do is to ensure veterans receive the care and services they deserve." I want to take this opportunity, Mr. Secretary, to remind you the people on this dais, both sides, have the same purpose. Many of us have been doing this for decades, and oversight is both constitutionally required and it is critical for all of us to do our jobs. So with that in mind, I would ask you to rescind the memo from your Chief of Staff, which allows him to personally sign off on any proposed or planned engagement with any one of the 535 members of Congress, which really just stonewalls legitimate questions that we have.
Yeah, Senator, that was a memo that's a missing characterization of that memo. It simply was coordinating between OM and our Legislative Affairs Office to make sure that our OM staff, who actually deal with the budget side, which you do, and our Legislative Affairs were on the same page, just as you wouldn't want to in your staff, talking to the same group and basically not being on the same page.
I have the letter, and it directly says that every request we have has to go through your Chief of Staff. From our staff who want questions, from any of us who do, everything has to be rerouted up to the top. That is going to take forever. That denies us the ability for us to get the information.
We'll make sure that all legislative inquiries, the stuff that you need, you're getting the oversight. I agree with you. I served in Congress as well. Oversight is important.
So
But
is
also
that-
getting you good information is important as well.
I appreciate that. So is that letter no longer in place, no longer applies?
That letter is the one that I'm familiar with, is letters to streamline information so we can get you actually information quicker.
Streamline all the way to the top so our questions are never answered. That's how we all read it.
No, that's not the way the letter is written, so
Well,
it is. It's not the way the interpretation is.
I would ask you to go back and look
Okay.
at, because again, we have oversight responsibility. We all take that very seriously.
I agree with you.
We need those responses. We don't need weeks and months to go through all the way to the top, and one guy's sitting there deciding whether or not we get information.
Well, there is no weeks and months, and that's, the unfortunate part of the VA has been a bureaucracy issue. We're trying to actually streamline
Okay.
it to get you the
I have
information.
other questions. I mean this. I'd like you to go back and look at that letter and remind yourselves we all need the information.
Thank you, Senator.
As you know, fixing EHR and getting it right for our veterans is about patient safety. During your hearing, I expressed my concerns about VA moving forward with deploying the new system at 4 additional new sites when it's still experiencing very serious issues at places in my state, Spokane and Walla Walla. And you said that when it comes to EHR, you were going to, quote, listen to our clinicians and listen to our hospitals. Weeks later, VA announced plans to look at firing a staggering 80,000 employees this year. I want to know, did you ask these VA clinicians and hospitals about how those cuts would affect future EHR deployments?
The issue of employment and EHR deployments are separate. We're not looking, again, I can't emphasize this enough. None of the reorganization that we're looking at deals with frontline workers or frontline employees that deal everything from cleaning a bed to there.
That was not my question.
So yes, we've included it. Dr. Evans, who runs our program, we've incorporated this. He's been working the program for well over a decade.
I have 20 seconds left. I've been very vocal, you know this, about VA's troubling decision not to renew the terms of researchers who are working on absolutely critical projects and clinical trials for our veterans. There are planned trials that have not started. There are ongoing trials that have been stopped, and there are trials that have fallen apart due to staff layoffs. Yes or no, would you agree that clinical trials stopping would have an impact on the care for our veterans?
I think clinical trials are very important, and the good thing about it is when we looked at it, there were trials that were coming due, that just as they always do. I put a 90-day stop on that so we can examine and make sure that everything's going good.
I understand there's a pause on this new policy. Has a decision been made about what happens when that pause stops?
We're currently in the process. of
So we don't,
examining that now.
clinical trials that are out there have no idea, they got to wait 90 days and pray.
At this point in time, like I said, some of those were actually stopped at the end, and what we're actually, keeping some in line so that they can continue if need be.
Thank you, Mr. Chair.
Senator Blackburn.
On behalf of the chairman, I recognize Senator Blackburn.
Thank you, Mr. Chairman. And Mr. Secretary, we are delighted that you are here today, so thank you for your time. I do want to say I have been so impressed with the way that you have tackled the EHRM program and that rollout. You and I discussed this in our first meeting and in your confirmation hearing and when you were in Nashville. And thank you again for making the Nashville VA one of your first stops. And I know that you are planning to take the EHR program live, pardon me, in 13 additional facilities in 26. And I know previously we have had an issue with VA employees showing up for the training and then utilizing the system. So talk to me a little bit about how you're going to continue this rollout and then get the employees to actually use the system.
I appreciate that, Senator. And I think one of the things is that we're looking at in this rollout, and I appreciate, and Senator Murray is no longer here, but we talked about this. This rollout is being done in a sense. What I found, when I found the system, basically the VA side of the house was sort of, we're not going to do anything, and we're going to make it all individualized. And then you had Oracle side that was, saying we could just finish this in a short amount of time. So what we've done is we've actually now said, put the onus back on Oracle to actually, provide what they're supposed to provide, and we've also cut down on our side the amount of delay that was caused that really caused the initial problems in the rollout, where we had 6 different locations doing 6 different things. So we've taken 8 or 9 committees that were all having to touch stuff before they could get back to a decision and cut that down to 1 committee that then can communicate directly with Oracle to get this started. Dr. Lawrence, which I appreciate everybody on the dais who helped get him through, is our deputy. He is now in place to actually take care of and oversee that, and we're bringing in others right now, and I've committed to him to whatever help he needs to hire to bring in to make sure that our system is safe and useful for our clinicians, to make sure that they have that. And so far, we've seen that actually occurring as we go forward. So I'm looking forward to it.
Okay, and then the employees that were instructed to go through the training, they've shown up and done the training?
As far as I know, Senator.
Okay,
yes.
that is great. And then let's see, how many employees have been released from the VA to date out of your totals?
Would this be out of the probationary firings? It was about 1,000.
About 1,000.
Yeah.
Okay, that is helpful. I want to ask you about the budget. The president's budget came out last week, and how do you view the resources that are in there for modernizing the VA? And can you give me some examples of how you're going to use these resources moving forward so that the VA is more responsive and in a more timely manner for our vets?
Yes, I think the budget that was presented by the president is actually one that it fulfills the commitment that we've talked about making sure our veterans are taken care of. And I think that's the big issue here when you look at the increases, and for all of the folks who've actually been saying and accusing us of, going to cut health care and cut benefits and cut all this, is just this. It doesn't add up when you look at the budget itself, which is has an increase either on base budget or also using TEF funds as well. So what we're looking at is how do we then use that combined with the efficiencies we're finding, either through our contracts or through our employee base, to make sure that we're putting more of those resources to our research, toward our clinical care, toward our front part, also toward and I know this is a concern from yours, is also toward community care, is how we actually balance the 2 needs. So these are going to provide the resources we need. It also provides enough money to continue the ERGM, the health record management system too.
And then how do we shorten the time that it takes for approval to move into community care? I just left a meeting with our rural hospitals, and they are willing to be a provider. And it is so much more convenient for our veterans to get the health care that they have earned and to get it in their communities when they want it, where they want it, at their convenience. And I think that community care is something that should be moved on today.
Yeah, it is, and we are doing that. I've made it clear to every staff that I meet, and especially in our hospital, that community care is part of the law. Mission Act is there if they meet the qualifications. And also, if there's always a catch-fall that if the doctor sees that they could get better care in the community, they can actually do that. What we have found in the last few years is that actually, and through memos and others, has actually been not encouraged. There was an encouragement to keep everything in the VA. So we're actually moving forward with those kind of things. What we're also finding, though, is there are a lot. We have a community care group right now that is actually looking at how we do community care, and I'm looking forward to seeing their findings here in the next week or so. But what we've actually found is some roadblocks that are being put in by our own processes to not get people where they need to go. So that's something that's very important to me, and we're going to continue to look at it.
Well, I'm going to continue to work on that issue, and I appreciate your attention
Thank
to
you.
community care. Thank you.
Senator Rono.
Thank you, Mr. Chairman. Facts are important, so why don't we get to some facts? You were asked how many VA personnel have been let go, and you said 1,000, but this committee had been given information that there were some 2,400 who have been let go, and then you're trying to get back to 2019 numbers, which would be another 70 to 80,000. So what happened to the other 1,000 or so that we have been told have been released by the VA?
Following the court order, they're back employed.
I'm sorry?
Following the court order, they are back employed.
Okay, so in other words, when you fired all these people or let them go, that you didn't follow appropriate procedures, and therefore you had to hire them back. That's not what I consider a process that is going to determine whether or not people are
I disagree with that
doing their
premise.
jobs.
We had one judge in one area do this. This court is still being litigated, so as you well know, the
We have
litigation
actually
part-
had in other departments where they have fired people, and other judges that have said you have to follow an actual procedure. So getting back to some factual information, in February 21, you claim that the VA has saved millions of dollars by firing staff. How much have you saved? You said millions. What's the amount?
Those millions in the round amount I'd have to get back, especially now with those who've come back, there's probably a different number that I'd have to get back with you on.
Aren't you prepared to give us that information, knowing that you are testifying, knowing that you will probably be asked for factual information such as this? So you don't know, even if you said in February that you saved millions of dollars by firing staff. And then you said,
Well, let me
Also, excuse me,
re-clarify
let
there.
me finish my question,
Well, we did say
please.
14 million when we did away with our DEI.
you say $14 million.
Yeah.
Okay, so then my next question is, where is all that money going? I have a series of questions relating to your comments on February 21st. So you said millions of dollars, now you're testifying. First you said you would have to get back to me, but now you're saying 14 million. Also, by cutting unnecessary programs, can you tell me what unnecessary programs specifically you have cut? And then you've redirected those savings, some 14 million, you say today, to veterans. And I would like to know specifically where these monies were redirected. Do you have that information
The
today?
number that I gave you just now on the DEI was the 14 million. Those have been directed to those with disabilities and prosthetics. We've also had a part of that millions was also contracts that were either terminated or renegotiated that we were in
I
the
think
process
you
of
need to
doing as
tell
well.
us exactly what contracts have been terminated, because that's that's the thing about a contract, you know? When you terminate it, you have to have a reason for that, otherwise you end up having to pay.
Senator,
So,
also in the contracts, you also have to,
specifically-
when you're going through contracts and renegotiation, you also have to make sure that you're doing it properly. We're going to give you all the information you need when those are actually finished.
I would hope that you would have had all that specific information today. You have about 500,000 employees at the VA?
I'm sorry, I didn't hear
Does
you.
that sound right? You have 500,000 employees at the VA?
No, we do not.
What is some number of?
About 470.
Okay, that's getting pretty close to 500,000.
Yeah, it's
So,
a little high.
in what categories are they employed? I mean, for example, how many nurses, how many doctors? Do you have this 470,000 employees broken down by categories of jobs?
Well, that is part of our problem, Senator, and I laid that out in my opening statement, and also in my conversation with.
But you don't know.
No, and
You don't have that.
let me say
You
something.
don't have that information.
Let me say something. Yes, we have over 300,000, probably closer to 400,000 position titles. But you know what the problem is?
Thank you. That
Before
would
I
help.
ever got there, we couldn't even find some of these when our HR people started to look at it. So we took what we
Okay,
had at that point.
Let me proceed.
Well, I just want you, if you want a direct answer, then I'm giving you a direct
You
answer.
have a lot of people who are working for you. I would like to know, because there are questions about
Well,
who
and I'm
are you
trying to answer your
actually
question.
going to let go when you get to the 2019 numbers that is your goal. So you were asked some questions about the clinical trials. That's very important to provide healthcare services to our veterans when they are enrolled in clinical trials. Do you know how many clinical trials are on pause? And do you know how many veterans are in clinical trials?
I'd have to get that number back to you.
Is it 10? Is it more than, are we talking about 1,000 clinical
No,
trials?
we're not
When you
talking
put,
about, but again, here's the question.
Can you give me a ballpark figure on?
No, I'm not going to ballpark because it'll be
Okay,
used
so you
against me
don't
next
know.
time I'm
You don't
here.
know how many people that you have put on pause so that they are not getting the healthcare services that they need, because that's what a clinical trial is. You are getting medication, you are seeing doctors, you put these trials on pause. You cannot tell me how many veterans are now being paused in their clinical trials. You cannot tell me how many veterans are enrolled in clinical trials. You also cannot tell me how many clinical trials impact some. Well, you have over 9 million veterans that you are taking care of. Clinical trials are very important, and you said so yourself. Mr. Chairman, I have other questions. It's very clear that our secretary has not come with much in the way of numbers, and I really don't know how he's going to go about getting to 2019 figures for cutting employees, and he can't tell us what the categories of employees are, et cetera, et cetera. So I think we're going to need to hear from Mr. Secretary again. Mr. Secretary, would you commit to coming back to this committee to provide us the kind of information we are asking for and to respond to questions?
I will get you the information that you asked for, which is
Will
what
you,
we've been doing.
will you come back to testify, or is this it for us with you,
I will
Mr.
get you the information
Secretary?
that you're looking for, Senator.
Mr. Chairman, we're not getting any commitment from the Secretary that he will come back to this committee to provide us the responses to our questions. Thank you.
Senator
That says a
Tillis.
lot.
Good morning, Secretary.
Good morning.
How are you doing? I guess it may
Having
be
a ball.
afternoon by now or close to it. Thanks for the time, a few minutes we just spent in the office. I was going to ask you some other questions till I ran into some folks at the elevator who are concerned over the proposed 83,000 cuts in the VA. And they asked me specifically, would I publicly oppose those cuts? I said, I can't. I said, what do you know about these cuts? What do you know where they are? Are they potential cuts that will improve access, outcomes, or cost? So my question to you, what I did tell them, though, is I don't believe cuts are real unless there's a rescissions package sent to the U.S. Congress so that we codify those cuts. And so my commitment to the folks that I was talking to was when I see that rescissions package, if it's at odds with what I consider to be in the best interest of the VA, I may vote against it. But right now, can you give me an idea of how you would rack and stack each of those 83,000 jobs and where you are in that process? And can we expect at some point in the future to have a rescissions package?
Yes, Senator. I think the biggest thing here is I think what we've got to understand is when you start out in any business, and I don't care what side of the aisle you're on, when you go out to look at somebody, you just don't go say, just go do something. That's been happening at the VA and many agencies in the federal government for a long time. And typically what you get is a spattering of this. You get some who are interested, some are not. So when you look and you put a 15% number within which everybody characterizes, and I've been, accused of firing 80,000 people here, which is not true. Nobody can predict that. And also no one in this dais on either side of the aisle can say that many people is going to be fired, because this is the reason. When you take a 470,000 person organization and you begin to look at its efficiencies, you begin to look at the fact that between the hospitals and the central office, you have added significant layers of bureaucracy that go into this. You can't do it. So we're looking at every step we can, but also I'm not going to play it out in a public arena, because that's the other time is if we start saying, here's everything we're looking at, then you start in a pre-decisional kind of format, you're not working it.
Look, I get it. What I tried to explain to them, I asked them, and I think some of them may be in the audience. I want to note that I heard you. But I asked them, how do you rack and stack it? Tell me which specific positions you're concerned with. Obviously, they don't know the answer to that because I don't know the answer to that. But here's the problem, folks. Is the VA just great? Do we just put it on autopilot? Because that's the question. When people say don't change, I'm saying, right, so you're happy with the current state. You're happy with a poorly implemented PACT Act that I tried to get people to hold off on until we got it right. Now we're dealing with a shortfall there. So look, don't be against something because it's new. And by the way, any of you need it, I got extra copies of Who Moved My Cheese in the office. We've got to move the cheese in the VA, folks, because we're not performing. When's the last time I've heard people stand at a parade and say appointments are rocking? Boy, they're doing great. When's the last time I heard that the electronic health record's great? Some folks need to lose their job on a poor implementation, and I've got your assurance that they're moving forward. Folks, the VA is not working for veterans. And if we just say everything has to stay the same and you just got to have more money and more people, you're looking at it the wrong way. Maybe at some point when we prove that we're improving access, improving outcomes, or reducing cost, when those policies come before me, then I get excited. But in the meantime, I'm open to anything that's going to improve the service to people and make an installment on a debt that we can never fully repay. But we need to be honest with these veterans and tell them change is necessary to do that. And so to the veterans that I met with outside the hallway today, you recorded it, but you can use this response. This response is, I'm open to any suggestion that improves the condition for veterans, period. And I can't say no to something because it makes me feel uncomfortable. I don't know if it's 83,000, 8,000, or 800, but I have confidence in you to go through that process. And at the end of the day, I will make a judgment on your decisions because I would expect a rescissions package to make sure that those positions are not going to be approved in the future. And that's how I will complete my job as a U.S. Senator. But in the meantime, I'm not going to say don't change because we have to change to do a better job for veterans, folks. And we have to be a little bit uncomfortable in going through it. Thank you.
Thank you, Senator. I couldn't agree with you more, and I think the interesting thing that I came in here today was, again, hearing some of the comments and opening statements and stuff. I would almost thought that that up until January of this year, there was no problems in the VA.
Like nothing to see here.
Nothing to see. So the minute we start trying, can we make things better? My only criteria that I have is looking forward in this is making sure that we're taking care of the veterans first. That is the only criteria that we're looking at going through that. And if that means we reshape the workforce, we do. That means if it goes, a goal is whatever a goal is. But at the end of the day, the metric is, are we taking care of veterans?
Senator Hassan.
Thank you, Mr. Chair, and thanks to the ranking member as well. Welcome, Secretary Collins. Thank you for being here today and for your own military service. And just a note to my colleague from North Carolina, a lot of us have been working hard on reform at the VA for a long time and agree that there need to be changes, but that is not what my line of question is about. This is about whether the so-called changes you are already making are being made with thought and transparency in a way that will serve veterans the best. In your testimony, you stated that the VA is an organization whose sole purpose is to serve veterans. You've also publicly stated that you plan to fire 80,000 VA employees. The quote is, "That is a goal, that is our target," close quote. Well, roughly 25% of VA employees are themselves veterans, meaning that if you do follow through with this plan, you'll likely end up firing thousands of veterans. It's also worth noting that the Veterans Health Administration accounts for nearly 90% of all VA employees. So if you're firing evenly across the VA, you'll end up firing roughly 70,000 VHA employees. So Secretary Collins, is your goal to fire thousands of VA employees who work to support and provide health care to our veterans? Yes or no?
My goal is to make sure that veteran care is done in the best possible way, and putting numbers in place that, of course, you have no blueprint for is not helping any veteran in this room.
The numbers that I am talking about are the numbers that exist at the VA now, and I'm basing my remarks and my questions on your public statements because to many of the other senators' points, we aren't getting specifics from you or your agency. Now, how many employees does the VA have that work outside of the Veterans Health Administration?
If you divide it up in the different administrations, it's the vast majority are close to, what will be the last number, 350?
So let me answer the question. Outside of the,
370,000 in VHA, the rest are off of
outside of
NCA.
the VHA, there are 54,000 employees. It is actually impossible
That's a
for
little
you to
low.
fire 80,000 employees without firing those who help provide health care to our veterans. And I'm disappointed that in all this back and forth, you seem to be trying to hide that.
Senator,
So
can I
no
ask a
one in-
question?
I-
I mean, I just want to respond to this because I have a question for you. My goal is to actually take care of veterans' health care. And when you look at an interior designer in a hospital, is that actually taking care of health care? I don't think so. Those are the kind of positions we're looking for. And you have multiple duplicity of stuff.
My point is this. If there are a few hundred here and there, but you are talking about 80,000 employees, 54,000 employees work outside of VHA. So you're going to have to you are taking a meat cleaver approach. There's that old adage, measure twice, cut once. You guys have been cutting without measuring. Now, let me get to another
Well, I've not
question.
cut anything yet.
No one in the Trumpet, well,
We've not cut anything yet.
2,500 employees
Well,
randomly.
there's been the-
No
of the
one in the
83,000.
Trump, Secretary, my time is my time. No one in the Trump administration has been able to explain how cutting nearly 1 in 5 VA employees won't harm health care and service for veterans. In fact, just last week, the VA's head of clinical services, the top doctor in the entire VA, came before this committee and stated that he has not been involved in any discussions about how firing 80,000 employees would affect veterans' care. And he had not seen or been provided any analysis as to how these planned firings might affect care for veterans. That is the VA's head doctor, the person in charge of primary care, emergency medicine, surgery, mental health, et cetera, saying that no one from your team has even bothered to once ask him whether firing 1/5 of all VA employees would make health care better or worse for our veterans. So, Mr. Secretary, why haven't you asked the VA's top doctor whether you plan to whether your plans to fire 80,000 VA employees would harm health care for veterans?
I will not speak for anyone else who gave that testimony, but I will say this, in VHA, VBA, and NCA, they all have working groups. They all have, at the senior leadership, have been working on this process.
Well, this doctor told us that he has not been involved in any of those discussions. Recent reporting states that the Department of Defense may cut the Army's active duty force by up to 90,000 soldiers. To cut the force by that much, we could reasonably expect that thousands of soldiers will end up leaving active duty and returning to civilian life, meaning that they will lose their military health care and will almost certainly turn to the VA. How is the VA preparing to care for those soldiers, and how does firing 80,000 employees support that preparation?
You know, again, the interesting part is they will be taken care of as every veteran who's earned the benefit going forward. I cannot state this enough, and we can continue this process with everybody who wants to ask, and I get it. But there's not been 83,000 people targeted for firing. There's been a goal to look at our restructuring and putting 15%. It's a nice talking point,
Mr.
but
Secretary,
we've not done
it's
it
your
yet.
talking point.
It's
It is your
15%.
talking
It is
point.
our goal.
We are quoting you saying that's the goal.
It is our goal.
Now, okay.
The goal is not a fact.
Do you want to reach your goal or not? Because
goal
most
is not a
people,
fact.
most people, when they state a goal, decide they'd like to reach it. If you don't want to reach 80,000, revise your goal and tell us what you want to do. Talk to us about the analysis you've performed. You've got a lot of knowledgeable people, both sides of this aisle. Both sides of this aisle want to serve veterans. It is our primary honor and privilege as Americans to do it. And we are asking to engage with you in a way to reform the VA, improve care, but make sure that that health care and those services are there for veterans. And just tossing out big numbers and cutting before you're measuring is not the way to do it. Thank you, Mr. Chair.
Senator Cassidy.
Can I finish that? Because again, this is the part. Ken Cassidy.
Secretary Collins.
Yeah, I mean, this is the problem that we have. And this is the problem that I saw when I was in Congress. It was a problem that I've seen everywhere. When we go into something and you look at it, you have to go in and look at the process to start with. You start with a goal, you start with what you're looking for, and then you use the data that you find from your organizations to make the best choices you can without a meat cleaver approach. But when you also start with the premise that is not true, a premise that is not going to affect, and basically saying things that we're not looking at, because I'm not sure how we get around the fact that we're not cutting, the primary health care of people who are getting it or cutting their benefits. That is not helpful in a collaborative process to say, are we working? The question I have is, the VA is not working in the way that it should work. I am trying to get it to a point where it can work for all veterans, and the workforce is a part of that. So, I mean, some think the VA is working undoubtedly, as I've heard this morning. It was perfect before this year started. That's not true.
And Mr. Secretary, that is unfair to the members of this committee, and you need to stop characterizing it that way, because that is not what a single person on this dais thinks.
Senator Cassidy.
So, Mr. Chair, I'm just going to say one more thing here. I am eager to engage in real numbers and non-magical thinking here. But you cannot, this witness and the VA cannot have it both ways. They cannot set out a goal and then get angry at us for asking what the impacts of that goal and those cuts would be. Thank you.
Senator Cassidy.
Hey, Secretary Collins, how are you, man?
I'm having a great time.
Good to see you here. Listen, I was just with a press conference back home, with reporters back home.
Okay.
I was asked one, and if you need to get back to me on this, I am okay with that. But they asked me about the VA Servicing Purchase Program, or VASP. And there was a COVID-era program helping veterans who, because of the COVID-era shutdown, needed mortgage support. The Biden administration abruptly ended it 2 years ago, according to NPR, leaving veterans in the lurch. There was something put in the interim. Now, apparently, Congress has not filled that void. Right. So I'm asking you about this, and if you have to get back to me, that's fine, but also kind of challenging the members of this dais. If Congress needs to step up and do something, then hopefully we will be able to do something. Let me turn it to you.
Yeah, the VASP program is something that we do not need to be in the mortgage side that we were with. The VASP program requires us to take on. So we, on May 1st, did end that part. It was a discretionary part. It was from ours. We did not have, that's not appropriated funds. It was used and generated from inside. We don't need to be in that business. I know there's been a lot of discussion on some legislation that is coming through dealing more partial claims that can actually give the veteran a help in the situations that they're in without having to go into the situation that VASP created. So that's the story on where we're at right now with that. Congress does have a big role to play in that. We look forward to seeing how that legislation, especially the partial claims, comes through.
Sounds great. Next, because Senator Hassan was saying, okay, we need to have some sort of objective analysis, you would agree we need an objective analysis. Believe me, I think all of us would say the VA needed some improvement. So thank you for taking on that big job. One thing that I've been proposing is something called VetPAC, which would be patterned after MedPAC and MACPAC, which gives advice from an independent board objectively to the public and to Congress as to how to reform, in the case of these two programs, Medicare and Medicaid, preserving benefits but doing it more cost effectively for the taxpayer. Senator Hirono and I have suggested something called VetPAC, and we've reintroduced that this year. My question for you is, we had submitted it for the legislative review. Your folks said they liked it, but we've not yet gotten the technical assistance. So it's something that's bipartisan, that would address a lot of this concern, a lot of the concerns being up here to give us objective reality, and you guys like, but we've not gotten our technical assistance. So just a request that, by golly, you walk out here, you call up somebody and says, hey, Cassidy and Hirono want that technical assistance, give it to them.
I think they're hearing that right now.
That's great. Yeah. It always helps when you say it too after you walk out the door.
Okay, we'll get the technical assistance to you.
That's great. Thank you, sir. Lastly, one thing that I've been concerned about, and to see where you are on this. I'm a doctor, and I like the fact that veterans, if they're not near a VA facility, can go to the private sector. But there's not been a good utilization review or prior authorization. Prior authorization can be a bad word, but I just know from experience that if someone goes someplace and there's no limit on the amount of testing that the medical facility can order, there's going to be a lot more tests ordered, and sometimes they're inappropriate, and sometimes they bring on complications. Does that make sense?
It does, and I think that's one of the things that we're looking at, especially in the community care working group that we have currently going, is making sure that we're looking to make sure that those equities are in balance as far as making sure the veteran gets what they need, the doctors have their authorization. We also have an issue, especially in community care, that is something I think you and I have spoken to, and that's our third-party administrator system. which it tends to be something that is a multiple complaint by many in the system because it is the sort of conduit between the VA and the community, and it's not been working as it should. What about my first week that I got there, one of the things that I did find out is the groundwork had not been put in place to actually do the renewal of contracts this year on those third-party administrators. There was supposed to have been work done in the prior. So we had to delay that, go to the extra year. So we're sort of stuck in a year here in which we didn't ask for. But it's now actually being able to get to the part that we're putting in questions. We're going to have a contract that's going to be much better in that authorization side, much better in getting the VA and the community on the same page.
I think you're working at least 80-hour work weeks, and so thank you for doing that on behalf of our veterans.
Thank you.
I yield.
Senator King.
Thank you, Mr. Chairman. Mr. Secretary, on February 24th, you announced, I think there was a video of the cancellation of hundreds of contracts, 875 non-mission critical. You characterized them as, and then there was a lot of reaction to that. So in 24 hours, the department made an internal announcement that you were reconsidering that guidance and offered a pause on the cancellations. Then on March 3rd, another announcement, 585 contracts would be canceled. You said they were non-mission critical or duplicative. On March 6th, I wrote you a letter asking to have a list of those 585 contracts. You mentioned earlier today it's not weeks or months. Well, in my case, it was 2 months. I got a response on Friday that was a non-response. It didn't give me the list of the contracts. Why won't you tell us what those contracts are?
We will be, as those are finished, as you well know, and as I said earlier, to the contracts, and we're doing in negotiations. Part of those contracts may be rescoping of contracts. They're not completely taking out one contract.
I understand that, but just give us a list.
When we get to the final, we will be giving those to you.
Well, I don't understand why you can't give it to us now. I just want a list of the contracts. It's been 2 months, 585 contracts. I want to know what they are. I mean, I
understand, Senator.
I'm an optimistic kind of guy, and I'm not suspicious, but the fact that you won't tell us what the contracts are that are being renegotiated makes me wonder if there are things in those contracts that maybe you don't want us to know about.
Well, I will say that from my perspective, that is not it, and we'll work to get you the information you need.
When?
We're working through it now. We sent the last,
How about by next Friday?
I'll get with our folks and see what we can provide you at that time, and we'll see what we can get to you.
Well, that's really not a very satisfactory answer. It seems to me this couldn't be simpler, just a list of 585 contracts. Somebody has that list. I don't know why you can't supply it to this committee. When you were confirmed, Senator Blumenthal said, will you commit to respond promptly to any inquiry from members of this committee to request information and be fully transparent with this committee? You said, that is my intention. For this committee, I will make that you have every information that you need. Well, this is the antithesis of transparency. Again, this is just, I can't imagine anything more simple than to just give us somewhere there exists this list. Anyway, let me go on to another question. There's been a lot of discussion today about the firings, and you've talked about a goal. What bothers me is the goal. If you're talking about restructuring the VA, shouldn't you be talking about where you need restructuring and not start with an arbitrary number? How did you choose 2019 as the number, as the target for your staff size? What's magic about that year?
Well, I think that was where you go back to the actual executive order, which we're following to go through to downsizing our government, making it more efficient and looking at it. And that was the determination from looking at a sort of a 15%. As we look at the targets.
But my problem with that is if you have an arbitrary number, whether it's 15% or 2019, that presupposes the result that there are that many unnecessary jobs. It seems to me you ought to do an analysis of where is the duplication. By the way, I'm not one that is advocating in any way, shape, or form that the VA was perfect on January 20th, 2025. I certainly agree that the staffing should be examined, the policies, particularly the red tape that Senator Tuberville was talking about. I think those are all very good things that should be examined, but it should be done in a thoughtful and transparent way. And I just don't understand why the magic. 2019, by the way, there have been 7 significant veterans-related bills passed since that year, including the PACT Act, one of the most significant expansions of VA benefits in recent American history, and yet the goal is going back to that particular year. It should be, the goal should be efficiency, not a quota.
Yeah, and that is what we're looking at, and that's what a goal is looking at it. But I also have to, one of the things, when you look at this, just last year, the previous administration, and through presentations that they made and other, actually advocated for a 28,000 person decrease in employees at the VA. So I mean, it's not a new thing to look at it. But we're doing. I want to agree with you here, Senator, that we are looking at this in a way that says what is the best part. One of the things also, there may be new applications, new legislations come forward, but there's also newer technologies, also newer ways and quicker ways that we can get stuff done. So that's the efficiency issue we're talking about.
Well, in the memo from your Chief of Staff on March 4th that talks about this, it says there's an information gathering report due March 10th, another report due April 10th. Are those, and then there's a department-wide review will be completed by May 9th. That's 3 days from now. Will you share that data with this committee, whose responsibility is to oversee the implementation of the laws and regulations on behalf of veterans?
Yeah, those are being worked on right now and are in the pre-decisional format, so there's not something to share with you on those at this point, especially the one coming up. In fact, we've actually had to have an extension because our department is so large, so we're not making quick decisions. We're not making moving forward on that at this point.
Well, I'll go back to my question, and this, I'll end with this. The reaction to the contracts request, which seems to me is so straightforward, doesn't fill me with confidence that we're going to truly have a transparent relationship here. We're all on the same side. We want the whole goal of everybody stated here today is to protect our veterans and to be sure that they get the services they've earned and the benefits that they've earned. And so to the extent you can work with us and allow us to understand what you're doing, that would be helpful to develop a more collaborative relationship. Thank you, Mr. Chairman.
Thank you, Mr.
Senator Bozeman.
Thank you, Mr. Chairman. Thank you so much for being here, Secretary. The VA owes it to the veterans it serves to evolve and provide them with the best possible experience. I appreciate your commitment to improving delivery of veterans' health care and benefits. I know improving the veteran experience is a priority that both you and I share, and we appreciate your hard work in trying to get that done. I want to thank you for submitting your fiscal year 2025 spend plan in a timely manner. The plan raised some questions with the Appropriations Committee and this committee as some of the numbers differ from what we expected. To date, none of those questions have been answered, and repeated requests for a briefing on the plan have not yet yielded results. As we are trying to get our appropriations bills done, will you commit to sending a team over to brief us as to what's going on and give us a little bit more detail so that we can
Yes,
work
Senator, we'll be
together
happy to do that.
to get things done? Very good. That was easy. 2025, 2026. Your 2026 budget request proposes a significant reduction in the VA's IT systems. DOGE review of the nearly 1,000 unique systems at the VA isn't complete yet. Would you consider balancing your proposed reduction in funding until we actually get that report done to see what they find is needed?
We're looking at that right now as far as what we do need, and we'll be able to work with you as we go forward on that.
Very good. You recently announced the ending of the VA Service Purchase Program, or VSP. That saw the VA take on modified home loans for veterans risk for foreclosure. I support the VA looking for ways to avoid the financial risks that VASP exposed the agency to. We're worried about the current population of delinquent veterans who are now enrolled. It's my understanding that as of May 1st, delinquent veterans who are not already enrolled in VSP are now at risk of foreclosure. Now that VSP is unavailable, how does the VA plan to help veterans at risk of foreclosure?
I think one of the things that we're looking at is the other, any other programs that are out there also that we go forward. But I think when you have to look at the organization, is this an area that we, need to be in? And I think those are the kind of things that the decision there was in people that had mortgages that were coming due. It was beginning to be a larger burden because we're not a system that's set up to own property. So we're going to be working that. And as I said earlier to one of the senators, I think we're also looking at it from a perspective. I know there's some legislation being talked about partial claims and stuff that can help them in the long term.
Good. No, I'd appreciate you looking at that. You know, it's one thing to, you know, going forward, it's another thing for those individuals that are caught up in that now, and makes it really difficult. How did the VA make the decision to reduce the VA's remote temperature monitoring program for veterans who have demonstrated both clinical benefit and cost savings to the VA?
Could you repeat the question?
Well, the VA's recent changes have impacted veterans' access to the remote temperature monitoring program. As you may be aware, this program is critical in preventing and reducing amputations required because of ulcers and other diabetic foot complications. Effective prevention of amputations results in significant cost savings for the VA. Again, are you aware of that? And if so, how did we come to that conclusion?
Senator, I'll have to get back with you on that one. I've prepared for a lot of things. That was just one I'll just have to get back to you.
Good. No, I understand. You certainly have a lot going on. During your remarks at President Trump's April 30th cabinet meeting, you mentioned that you and Secretary Kennedy have discussed the potential of researching psychedelics as an effective tool to combat PTSD, TBI, and other mental issues. Can you provide further details on how your team plans to take on action on this interest? I think the committee is very interested.
I can. I think it's something that I'm committed to doing whatever we can to provide veterans and those who have maybe not responded to traditional care and others, especially in the area of PTS, also TBI, the other issues that we're dealing with that lead to a lot of what we've seen in suicide and death by suicide. So we're looking at right now, I think there's 11 studies that are going on. Most are performed outside the VA with our help. MDMA is another one. I just saw a program at Emory University in which they're seeing some really good results. A single treatment, then followed up by 2 weeks of intensive, counseling that actually has lowered the score number on the PTS scale. I think I'm willing to say this, is I want to work with, and I said this with HHS and with others, that make sure that we're not closing off any outlet for a veteran who could have be helped by these programs. And I think, we'll definitely be working with Congress on that if there seems to be something else we need to have.
Very good. Thank you, Mr. Chairman.
Senator Sanders.
Thank you, Mr. Chairman. Secretary Collins, do workers in the United States have a right to be in unions? Secretary Collins? Do workers in the United States have a right to be members of unions?
Okay.
Yes or no?
Yes.
Okay.
I didn't know it was a question.
Okay. President Trump issued an executive order banning collective bargaining in the VA, eliminating union rights to 79% of workers there because of security reasons. Do you think that workers in the VA are a threat to national security if they're a member of a union?
I don't think that was the purpose of the EO, Senator.
That's exactly what he said. Then why did you eliminate collective bargaining rights at the VA?
I think the interesting issue here is that's not what the EO is about. The EO is our national security interest of our fourth mission. And if you look at the entire EO, is about making sure that the fourth mission is not.
Is a nurse at the VA a national security threat by being a member of a union?
Okay, sir, I can't answer the question. We're on different pages. It's not the fact that the VA is a national security threat. It's a national security threat that if we can't perform our fourth mission,
that's
looking at.
Well,
I mean,
that's what. Bottom line is unions. 79% of workers at the VA are union members. They no longer are able to engage in collective bargaining. To me, that is an outrage. I think the courts will overturn that. Next question.
Well, at this point, that's not true. At this point, that's not true.
All right. Let me ask you this. Do you believe that every veteran in this country, as I believe, and I think many members of this committee believe, are entitled to VA health care?
As a veteran, yes.
Yeah, okay. What are we doing right now? What are you doing to improve outreach to bring more veterans into VA?
Well, I think that's, let's go back to a question you just said. Does everybody have a right to be in a union? The answer is yes. Does everybody have a right to, on the benefit that they've earned to come to the VA? But I can't force them in.
No, of course you can't.
And
But you can, but, of course you can't force
I'm
them.
missing maybe the point there. I apologize.
The point is, there are a lot of veterans out there, I know this, I used to be chair of this committee, who do not know what their benefits are. And it's our obligation to say to veterans all over this country, you put your life on the line to defend America. Congress has passed A, B, and C. We welcome you into the VA if you choose to come in.
Yeah, Senator, I think this is a great place for us to have an honest, a conversation, because I'm concerned about this as well. And part of this goes back to how we're actually transitioning out of DOD into VA.
That's one of the factors.
And I think that's one of the big things. And there's an honest conversation here. Is it properly placed right now?
Good.
Transition. So I'm wanting to do that. Good. And we're doing outreach all the time with our vet centers and everybody else to let people know.
Okay. I think we could do a better job.
I agree.
We have to.
I agree completely.
Okay. Question. We talk about VA healthcare, which is what we're here to talk about, but we don't put it into a context. We are living in a nation which has a broken, dysfunctional, wildly expensive healthcare system. In your judgment, just out of curiosity, how does VA healthcare compare to healthcare out in the regular world for civilians?
I think in certain areas, just like we're out in the regular world, you have some hospitals that are performing exceptionally and you have some that are not. I think that's the problem that we have in our healthcare systems in general. I think this is something I said earlier. We can't separate out VA from the healthcare system as in a whole.
That's true. All right.
But sometimes we do that.
All right. Let me ask you this. My understanding is that we have, roughly speaking, a shortage of 2,500 doctors, 6,600 nurses. All right? What are you guys doing to bring in more doctors, nurses, social workers into VA where they're desperately needed?
Well, one, I want to move doctors that are not working with patients and move them into patient care. That would be a good start. Nurses as well. Also, I'd like to have help from the Congress as well. We need to actually look at our pay structures and our caps on our doctors and what we can pay them. It's very difficult to compete when you're offering at some points hundreds of thousands of dollars less for someone to come work at the VA.
All right. Do you acknowledge, I agree with you, do you acknowledge, though, that right now there is a shortage of doctors, nurses, social workers in the VA?
I acknowledge there's a shortage for everybody in the healthcare industry on those same issues.
But in the VA, I'm not criticizing. I'm just saying.
I mean, we're the same as everybody else. That's why I said we are the same as every other healthcare system. We're struggling to recruit doctors, nurses, and others just as anybody else, and that's something we're constantly in outreach about. Sometimes it's helpful, sometimes it's not.
The Department of Defense has a medical school. You're aware of that? Uniformed Services Medical School, which does a very good job. Do you think that one of the problems we have overall is that we're not graduating enough doctors and nurses in America?
Yes.
All right. Do you think we can be expanding schools like the Uniformed Services Medical School to bring more people into DOD and VA healthcare?
It's an interesting concept. I think we got to go back to a deeper issue: is why are more of our young people not going to school to go to be a doctor, a nurse, or other things? I think that's a bigger issue.
Fair enough, but that has to do with it. I'm a working class kid. I'm going to graduate medical school $500,000 in debt. Correct? Is the idea of entertaining programs saying you want to go to medical school, we're going to pay for your entire tuition, et cetera, to encourage you to get the medical school grad?
I think anything that we can look at to encourage that is possible. You already have that when you can go into the medical and they'll pay for in DOD, they'll pay for your medical school.
But it sounds like we may want to expand that.
It's something that we can, I think it's something as an overall healthcare system, Senator, you and I probably agree on this probably more than anyone else, that we've got to make sure that our pool of workers is adequate for all of our systems, not just the VA. And the healthcare system in our country is an issue that we have right now. And I think it's a bigger discussion. I appreciate you bringing it up, and it's something we look at.
Okay, thank you.
Thank you.
Senator Kramer.
Well, I was encouraged by that dialogue. Thank you, Senators and Mr. Secretary, and welcome, Mr. Secretary. It's a good thing I haven't been here all day, or that I'd have way too many things to talk about. But right now, I want to raise an issue related to the discussion you just had. You know, we just passed, under the first Trump administration, we passed the pilot program for Solid Start Act, and then under the Biden administration, we made it a law specifically to get at the issue that I think Senator Sanders was raising about how do you attract or inform veterans more about the opportunities and the benefits that they have at the VA. And so I would just encourage you to look at that and make sure we're managing that well. The other thing I would raise with regard to the workforce, which I think Senator Sanders is right about, and it is true, we have a shortage of people in healthcare everywhere. And to the degree we can incentivize it, I think we ought to. At the same time, and I'm just going to give a little North Dakota example, and Senator Blackburn spoke to it briefly toward the end of her questioning. In North Dakota, in this rectangular spot in the middle of the North American continent that's about 350 miles across and about 200 miles up and down, there are 36 critical access hospitals in rural communities. Now, Fortuna, North Dakota, to Fargo, North Dakota, where the only VA hospital is 412 miles. Takes roughly 6 hours and 19 minutes if you don't stop to go to the bathroom to go from one to the other. But there are these 36 critical access hospitals that have 20 hospital beds each, and maybe 2 or 3 of them are being used at any given time. Senator Blackburn talked about community care. We've talked about the shortage of facilities, shortage of workers and opportunities, and yet there's all of this infrastructure not being used. There's got to be a way to utilize existing infrastructure and actually save money, both for the VA and then create opportunity for these struggling hospitals in rural America.
I don't disagree with you at all, and I think it's actually, Senator Duckworth and I actually had this conversation a long time ago about actually co-locating CBOCs and stuff that we could actually do that. I think that's a great idea as we look at it. But I think one of the things is how we, utilize the Mission Act possibilities that we have. You make sure that we're getting people there. The other problem we have, and this is found not only in some of our facilities, but mainly some in DOD facilities, but also community facilities, it's also an issue of quality care. Yes. It's an issue of our doctors seeing enough patients to keep their clinical skills up, or nurses seeing enough to keep their clinical skills up. That's why I've already been looking at several options, and we're doing this in certain cities now where we can. I'm encouraging every one of our facilities to have understanding agreements with local hospitals, with community hospitals, so where they can go back and forth. We can also look at DOD facilities, which is also a big issue. We have underutilized DOD hospitals, underutilized DOD facilities, in which we could be one of those. Actually, we're looking at right now in Jacksonville, Florida, in which we could actually save our community care costs because we could actually have a DOD facility there. So it's a lot of things we can work on here, but I think it's just a matter of using all the resources that we have.
Right, and that starts with knowing what they all are. That's a great illustration of the one you just made. One of Kramer's convictions is I reject the notion that every transaction requires a loser. We should look for opportunities for winners and winners, and I think that would be one of them. Congratulations, thanks for doing that. I want to get back to the 80,000 thing, and because you've been being battered about it, I think without us acknowledging the other issue. I'm going to stick with a lower number. Correct me if I'm wrong, but I believe there were 52,000 new positions added between 2021 and 2024. Does that sound about right? 52,000 during the Biden administration?
Yes.
Okay. And how has that improved the health care offerings for veterans? Are we seeing a lot more veterans? Is it better care? Is that 52,000, has that really been, has that saved the day for our veterans?
Yeah, I don't think so, because I think if you also, I use it in a different way. If you go back to 2015 when the GAO put us under the high risk, and again, I've been here all of, barely 90 days at this point. Looking at this, I'm using the numbers that we are given, and we can talk about whether the numbers change or anything else. I'm using the numbers that we currently have at VA. Wait times have increased. Primary care, mental health, specialty care, all rose. Disability backlogs. It's not a secret. It was at 260,000 when I came in. It's about 220,000 now. These are just honest numbers. But I want to go back to something at 10 years ago. At 10 years ago, if I had told this committee, and I had told, and I did this at our senior staff, and I told, this is careers and politicals, I said, if I told you that in 2025, you're going to have a budget of almost $400 billion and you're going to have a workforce of 470,000, you would have thrown a party, everything would have been great, because that would have been the answer to everything. Well, we're 10 years later, and we're still experiencing the same problems.
No, well, I appreciate that. I do-
Servicing the same amount of veterans, too,
Yeah,
by the way.
that's the important point. I appreciate all of that. I do think I think everybody on this committee wants to have an honest discussion about how to do better for our veterans, and that kind, real data can help us, because there's plenty of data there to tell us where we've been okay, where we haven't been so good, and where we've been awful or great. Thank you, Mr. Chairman.
Senator Kramer, thank you. Senator Duckworth.
Thank you, Mr. Chairman. I do think it's important to acknowledge that we did sign up, just in the first year of the PACT Act alone, 1 million veterans. So that increase in personnel is also to deal with the increase in veterans coming to VA for care, long overdue for their acts because of their exposure to toxic substances.
Yeah, we also
And that was
lost about 400,000 veterans that year as well, so it does equal out a little bit.
But we had well over 1 million in the first year
Understand.
signed up. Secretary Collins, when you testified before this committee in January, you stated that it would be a mark of failure, your words, mark of failure, if a veteran must contact the congressional office for support with accessing their VA care and benefits. My office alone has received 143 casework requests from veterans since the start of the Trump administration, a consequence of service disruptions worsened by DOJ's cruel dismantlement of the VA workforce and of the critical programs serving our nation's heroes. I'm going to give you some examples. A Vietnam veteran did not receive his benefits for 3 months due to greater than usual processing times. A veteran in urgent need of mental health services was told that the earliest available appointment was 6 weeks away. A veteran's widow and cancer survivor had her CHAMP VA covered prescription canceled without notice, forcing her to pay $700 out of pocket. An Iraq War veteran needed his records to apply for his disability benefits, but was met with a 6 to 12-month backlog. Now, backlogs and delays are not new to VA. They were there when I was at the VA under Secretary Shinseki in the Obama administration. And so I think, I would agree that this is indeed a mark of failure, and I'm requesting your commitment to work together to overcome this backlog. This will require the immediate reinstatement of all 2,400 VA employees who were indiscriminately terminated when Elon Musk and his Doge cronies failed to evaluate civil servants on the basis of merit and failed to use a scalpel to root out the bad apples who are failing to effectively execute the mission, and instead chose the most wasteful, inefficient, and lazy path in simply firing probationary employees en masse, which ironically represent some of our nation's most motivated, most idealistic, and most energized federal employees, those probationary employees who signed up since the PACT Act was passed, for example. Those Americans, including thousands upon thousands of veterans who made the patriotic decision to serve their country and begin their civilian careers. Secretary Collins, will you commit to reviewing the status of all terminated VA employees and promptly reinstating them and to protecting the VA workforce against additional indiscriminate mass firings?
Well, most of the ones that I've already testified earlier, the probationers were brought back to work in that setup, so they're already back at work. And we're going to keep looking at our setup and how we do it, because nothing we've done so far. We protected over 300,000 plus positions that were not, that did not, they protected those that were directed with disability care and with health care benefits. I just have a question, and I appreciate your concern, because I do still think when they have to call your offices, it's a failure for us. I say that to all of our hospitals, and I say it to all of our veterans benefits. I have a curious question here. You brought up something that's very close to my heart. Was that veteran who was given 6 weeks for an appointment, were they given a community care option?
We could get you that information, but if you
I would
appoint
love to know,
somebody to
because
work
I
with
want
me
to
for
help
our
that. I want to help if we can.
with all 100 and with all my open cases, I would love to work with you.
Is that
on
also
it.
and also, again, I've acknowledged this from day one. You and I've talked about this. The calls to our VA represent something we're not doing right. And I think that should overlay everything we're talking about here, is why is this a problem? Why are we still there? Records that take 6, 12 months, that's possibly, I'm assuming that's probably a DOD issue, trying to get the records out of the DOD. These are all issues that I want to try and fix.
There have been access with VA records as well.
I agree.
Let me just go on to the next thing. In an official letter, response to Senator Tammy Baldwin's oversight letter on the Veterans Crisis Line, dated April 7th of 2025, you wrote, and I quote, "While 24 VCL employees erroneously received probationary termination notices, all notices were rescinded. All terminated employees were reinstated and have been rehired into the same positions they previously held," end quote. Secretary Collins, while I appreciate your candor in finally acknowledging that, in fact, VCL employees were terminated and clarifying that this was incompetence and not malicious intent, I hope you recognize that your work in fixing this mistake is not complete. Personally, I know of at least one veteran who you still have failed to reinstate, and this was a person who did so well that they were promoted to help train other VCL hotline employees, the type of person who's a supervisor on a shift. They still have not been reinstated. Look, the Veterans Crisis Line serves veterans in their darkest hour, and it is our responsibility to make certain that it operates to the highest standards. Just as every military commander understands that our warfighters' effectiveness, indeed their lethality, depends on a fully resourced, diverse network of enablers possessing the capability and capacity to support a given mission's requirements, you can't just invest and rehire the pilots of the aircraft and not retain the refuelers and the mechanics who fix that aircraft. Secretary Collins, do you agree that support staff who train, equip, and handle the basic operational and administrative functions of the Veterans Crisis Line program are mission critical?
That's why we brought them back, Senator. And I think there's something, though, that we need to also clarify here, and this was clarified not by our senior level, it was clarified by career employees, that no VCL who answers the phone, who talked to our veterans, was let go.
Right, but it's, the VCL can't operate without the other people as well, like the supervisors on shift or the people who train the VCL. You are parsing your words, and there are Veterans Crisis Line people who have been fired, who have not been reinstated, and these are people who actually are training the people who are answering the phones. These are people who did so well as a phone answerer that they are the supervisors of the people, and you can't, like I said, you can't just say, okay, we're going to take care of the pilots, but not the refuelers and the mechanics who maintain that jet.
And I think we can actually find common ground agreement here that that was why they were brought back, but also I will not accept the premise when it was given that people were not being answered on the call line when they came in, which has been talked about many times in the press by others. That is not true. I'll acknowledge the fact that we brought back staff to help in those situations, and that's why they're now exempted. Sometimes, and we did do that, but I will not also let it be put out there that people were not getting their phone calls answered because those were the ones that were let go. Those were not the ones that were let go, and I think we at least need to be honest about the situation. As far as I agree with you, that's why they brought them back. And if you have a situation with one person, please let me know, let my office find out, and we'll talk about it.
There are more than one person being affected.
Thank you.
Senator Sullivan.
Thank you, Mr. Chairman. Mr. Secretary, thank you for your testimony today. We all want to take care of our veterans. And, you know, you and I have talked about it, and I want to thank you on a couple things. One of the biggest issues I've seen in my 10 years here, one of the biggest scams I've seen in terms of hurting veterans was the implementation of the Camp Lejeune Act that we passed here to help Camp Lejeune Marines and their families and sailors who were exposed to toxic water. You want to talk about taking care of Marines? I worked, and taking care of veterans, I worked with my colleagues on the other side of the aisle for years to try to get them to cap contingency fees to the lawyers who are advertising billions of dollars on Fox News and CNN. None of my colleagues would do it, none of them. Why? We know why. Every one of them knows why. So these law firms were charging 60 and 70% contingency fees to steal money from sick Marines and their families. That happened. I met a woman outside right there. I asked her about it. She said, I'm paying 40%, Senator, from some rip-off law firm, okay? I try to get my Democrat colleagues, by the way, the former chairman of this committee, who's no longer here, bye-bye, I think, because he was screwing veterans and favoring trial lawyers over veterans. So when we talk about taking care of veterans, I get a little miffed when my colleagues over here bring the show and they wouldn't do it. You know who's doing it? You're doing it. You're doing it. Thank you. You put out a scam alert saying if you are getting charged over 25% by a law firm, and by the way, the Attorney General of President Biden worked with me to put that 25% cap. My colleagues wouldn't do it. No, 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 no. So it's a little rich when I hear everybody talking about taking care of veterans, and I spent a decade trying to get Democrats to help me, and they never did it. You're doing it, so I want to thank you for that. You put out a scam alert. There are still law firms who fund Democrat campaigns who are still charging Marines and their families 60 and 70%. So can you continue to work with me in this committee to put out scam alerts so these patriotic Marines and their families and sailors. And by the way, this is zero sum. You get $1 million, okay? It's either going to go to the law firms or to the Marines. And I know what side they were on, and I know what side the former chairman of this committee was on. And you're on the side of the veterans. You're on the side of the Marines. You're on the side of sailors. So thank you. Because you know what? It's a little rich for me to watch all this theater when I know that you're taking care of them. You want to comment on this? I appreciate the scam alert, but gosh darn it, I'm still seeing these ads on TV. My staff calls these law firms 70%.
Yep.
It's the biggest injustice I've seen since I've been here as a senator. Ripping off sick Marines and sailors and their families, and nobody's on the other side of the aisle helping. None. I worked this harder than any other issue since I've been here as a U.S. Senator, and you're helping. Yep. You want to just comment on that? Thank you very much for the scam alert. And by the way, the former Attorney General said, if you're a law firm and you're charging a sick Marine more than 25%, that's a criminal violation. I've talked to Attorney General Bondi, and she is going to bring it. Criminal and civil violations if they go over 25% or 20% if they're just doing the administrative filing. So thank you on that.
Senator, I appreciate that, and I'll work with anybody on this committee. It doesn't matter the side. If you're doing something that shouldn't be done to our veterans, I've said this before, I take this personally. I take it. We can disagree about things. We can disagree about numbers. We can disagree about anything else. But at the end of the day, I want to honestly say that I believe all of us are trying to get the veterans help. And when you have folks who do that, when you have firms that do that, we'll continue to put the scam alert. If they're watching today, they can get mad at me all they want. I really don't care.
Trust me, they're mad at me. They're coming for me, but I don't care.
Yeah,
right? Because I know I'm doing the right thing for United States Marines and veterans and their families. It is the right thing. Everybody here knows it.
Yeah, it is. I agree with you.
Let me thank you on another thing. Every year, every hearing, I've been coming to this committee talking about the Alaska backlog. My state has more veterans per capita than any state in the country, right? It's a proud heritage of the great state of Alaska. And the previous administration, the backlog to just get an appointment ballooned to, it was almost 15,000. Okay, we got 80,000 veterans. That's like 15%. It's over 15%. Finally went down when I pressed the former secretary to 5,500 at the end of January when the Biden administration left. Still way too high. You know what it is under your leadership, Mr. Secretary, right now? I'll tell you. It's 1,361. I don't think I've been here the whole time where that backlog has been that low. In 3 months, you did more than Biden did in 4 years on the Alaska backlog. So I want to thank you for that, because that is real service for our veterans.
Thank you, Senator. We're going to continue to do that for all veterans in every state. We want to make sure that those numbers are coming down and that the veterans are getting the benefits that they deserve and also the health care that they deserve.
And if you can help us finally get a call center up there, I know it's an issue you and I have talked about. It'll bring that backlog even down further. But I want to thank you on both those things. I'll submit some questions for the record that relate to community care and some of the other issues you're working on. But on both of these issues, I appreciate your focus, because this is what taking care of veterans is.
Senator Slotkin.
Bringing down the backlog and making sure our Marines and sailors don't get scammed.
Thank you, Senator.
Thank you. First of all, I just want to recognize the chairman. Thank you for holding this hearing. I think it is a bipartisan goal to support our veterans. And I think it's one of the first hearings I've had where, after confirmation hearing, we've brought the secretary back in short order, so I appreciate that. Secretary Collins, during your confirmation hearing, you assured me and the others here that, quote, the mission is the veteran, and, quote, that you would not sacrifice the veteran. I took you at your word, as did many on this side of the dais. But since you've taken office, you've heard it, you moved to terminate VA contracts, offered to buy out VA employees that were in already shortage situations in those career fields. You placed a hiring freeze on critical VA employees serving veterans. 2,400 recent VA hires were let go, and then I think because of the courts brought back. You've been here today doubling and tripling down on that. I have no problem with cutting fat on the VA. I worked at the Defense Department. If someone had said to me, cut fat, I know exactly where I'd cut. but it's the nature of the cuts. If you're firing someone on a Friday and they're being brought back on a Monday, no CEO in America would be lauded for that kind of sloppy cuts. And then when you came to Michigan, you came to Howell, Michigan, I think in the last month and a half, you were asked directly about the potential for 80,000 additional employees to be cut. And instead of pushing back, you just said, quote, there's going to be a lot of friction. And I understand that you're wordsmithing things to say that no nurses or doctors in the VA facilities are going to be touched. That is good, but I held a roundtable with veterans. These are folks who are in the business, and their concern was that if you are a veteran and you walk into a VA, in Iron Mountain, and you need to get a claim, you put in a claim to get a knee surgery, and there's no claim caseworkers, there's no people working on those claims, and it takes you 2 years to get an answer, that's also not access to care. The doctors and nurses may be there, but if you can't go in and you're in pain every single day, that is also a problem. It's a problem for veteran center staff who have not been excluded, primary care administrators, IT staff. I know it's wonky, but you've just accelerated the electronic health record transition. I think IT staff are important if we're going to make sure we don't lose records of our veterans. And then benefit claims administrators. These are all people who kind of don't meet your criteria to be saved. We all want to serve the mission of the veterans, but what was really strange was that we had the deputy chief medical officer up here for a hearing, and we said, what's the plan on cutting, this potentially 80,000? Have you been consulted? And they said very clearly no. So I'm having a problem understanding how I'm to believe that the veterans in Michigan are going to get the same or better care, which is what we want, when you seem to be sort of, I don't know, you're claiming that these 80,000 are like DEI and interior designers. There's no way that all those 80,000 are in those job fields. So help me understand how you're going to preserve, that veteran who needs this knee surgery, but there's no one to process his claim.
Thank you, Senator. I think there's a lot to unpack there, and yes, the mission is the veteran, and I think I want to go back to one of the statements you made earlier. If you said DOD, you worked in DOD, you could go in and find it. If I would just happen to turn the table and say, if you came to work at VA, you'd probably be able to do the same thing.
For sure. I don't have a question with that.
So I think that's.
But 80,000 is different than cutting. I mean, and I think again, any CEO in America who fires people on a Friday and rehires them with back pay a week later would be fired from their job. It's sloppy, and you know it.
I think I'll disagree with the judge's decision there and continue the appeals process on that. So, I mean, look at it from that perspective as we go forward. But also, again, when you look at these issues and you look forward, I mean, it's interesting to me. I would just be curious, and I'm just playing the scenario out. If you go into DOD, is 20,000 a proper number? Is 50,000 a proper number? Is 10,000 a proper number? At the VA, we exempted over 300,000 positions to ensure patient care, patient quality, and disability benefits were being done.
So how come there were people fired and then rehired from the Veteran Suicide Hotline? Like, you've acknowledged, I think, even publicly, that some of these things were a mistake. It doesn't give us confidence that an 80,000 number, which is just a number, you didn't say career fields, you didn't say whatever, you just said 80,000, that's being done with a scalpel and not a sledgehammer. And I think for veteran care, again, it's not me that's the only one asking these questions, it's veterans who have a very different political view than me, who are getting seriously agitated back home. So I just don't understand the logic behind a across-the-board haircut.
Well, I think the biggest thing is what you're looking at here is, I think right now there's been, because that's what I've had to fight for the whole time, is to fight this idea of just being blanket numbers, throw out, playing Trivial Pursuit with numbers and others.
Right.
It has scared veterans. So honestly, what are they going to hear? If all they hear from people is, if you cut this, then it's going to actually impact my health care, then what are they actually going to think? Because one, they've not seen a plan. You've not seen a plan, because we're still working a plan. I'm not going to play out a plan in public that would actually take employees. You wouldn't do it in your own office.
And I know I'm over, but it is playing out in public
goal.
because you have fired people and then they have been rehired. That's not a secret plan. People in my district, Marines, veterans, have been fired from their VA jobs and then brought back. So it's not that there's some sneaky plan. You're in it. You're living it, and you're living the sloppiness of it. So I'm sorry, I know my time's over, but I can't agree that the 80,000 is going to be a nice, trim scalpel approach.
We'll just have to agree to disagree, Senator.
Senator Banks.
Thank you, Mr. Chairman. Secretary Collins, the President's budget calls for a nearly $5 billion increase for the VA, primarily for medical care and for homelessness. You have been accused of cutting care and benefits. We've heard a great deal of that today, which is obviously a scare tactic. How do you plan to target the new funding that you are requesting?
Exactly what you just said there, and that is to our healthcare side. I mean, community care side. Community care is growing, but it's actually been under budgeted in the last few years by the previous administration. So we've got to actually make sure that the proper monies are being put into community care. Also looking at how we actually need to improve our direct care services. We've got a lot of issues out there that range from not only recruitment and retention of employees, but also our facilities, the things that we have. Our average age of facility is well over 60 years old. These are the kind of things that we're working right now that, again, along with a reshaping of the force that we're looking at right now, looking at our contracts to make sure that some of the folks sitting behind me actually get the care that they have deserved and earned. It's interesting to me, though, again, when we talk about here in the last little bit I've had in some of the conversation today is where people have called offices and said they've had, appointments that are delayed or they can't get it. I just simply, and in all fairness, I just have to ask, that was the same thing happening in December. That was the same thing happening in November last year. There's the only difference right now is I'm sitting here saying we are looking and going through a comprehensive approach on how to size the force at the VA and spend the money that you and the House appropriate to us. That's the only difference. People have had to, and again, I could stand veteran after veteran after veteran standing here saying, I couldn't get in to see my appointment. I couldn't get in. The problem is, when was that? We're still working on that because we have issues in our system. Then the bureaucracy is not good. And we had hospitals and VAs who are not sending people to community care.
Cutting bureaucracy means better service for our veterans.
Yes.
And that's what you're doing. How are you planning to reinvest any savings from headcount reduction to improve services for our veterans?
That'll go back into our different services. And I think that's what we've already shown and had the sign off on, taking it back into community care, back into improving our IT systems, back into improving our prosthetics, back into improving our situations when our mental health counselors and others that we can actually show real results in. One of the things that's amazing enough that's not been talked about here today, and I think it's, for me, has been the top line that I've talked about all along, except in a way that frankly was not truthful in the sense of what we're doing, is suicide has not been discussed here today. And the issue that we still have since 2008 have not seen a significant decrease in our veteran suicide rate. Since 2008, although we have spent literally billions of dollars on that. So when we talked about earlier, we talked about other kinds of care. We've talked about, how can we do tap into research into maybe psychedelics or other things that help. Getting in more with our VSOs and our nonprofits to actually make a difference here. I think this is something we've got to have. We sometimes get caught up in the overall scheme of the VA, believing that the VA, unfortunately being on the Hill, is something that is manipulated or brought back into a certain way that is special. We're special in the sense that we get to treat the veteran of the United States. It is the most precious gift that we have. But we're not unique in healthcare. We experience the same issues that all of healthcare that we got to speak about earlier. And we're going to make sure, just as every other healthcare organization goes through this kind of look and reorganization of their facilities, they do the same thing.
And I appreciate that you're focused on that very much. Can you go back to the reduction in force, though, and tell me how much do you expect the reduction in force to be retirements or early retirements versus separations?
We're seeing a good bit of that right now. In the sense, as you always have some, we can't, that's one of the things that I've had, I got accused of and from the cuts that we had, that somebody had not been able to get their next appointment and the doctor had actually just retired out and they were just bringing in the new doctor. That's not only any reduction in force, that's just a simple matter of attrition in the hospitals. So some of that will be taken care of. Some have taken the early retirement possibility, which has been a program that I think has worked in a great deal. So some of that will be, normal attrition like that, and also the incentivized attrition.
I'm almost out of time, but I want to ask you really quickly, reviewing the situation that you inherited. The Biden administration's 2025 budget was misleading, as you know. They misrepresented the budget shortfall that they created. Congress closed the immediate $6 billion shortfall in March, but are there still budgetary problems that we have to clean up?
I think that's what we're trying to work through right now. I promise, what's interesting is as I promised in my confirmation, I think you remember, maybe you and I had this conversation. I was not going to come to this committee or even send you information in which I can't give you either the information because it was not ready yet or we wasn't comfortable where the numbers are. The same thing applies to a lot of the questions I've got here today. As we move through these processes, we're going to make sure that we give the information. We're working through a budget process right now that doesn't come and surprise you in a political way at the end of the year. So I think that's why the president in his budget, which is very favorable to the VA in looking at what we need to do, is something that we can then build on and give you more information as we go.
Thank you for what you're doing.
Thank you.
I yield back.
Thank you. Mr. Secretary, we're going to have another round, but there's only the two of us, Senator Blumenthal and I. Senator Blumenthal is committed to 5 minutes. I have a constituent waiting in the back room. I'm going to be back in 5 minutes. I have a couple of questions for you, then we'll conclude the hearing.
Okay, thank you.
Senator Blumenthal.
Secretary Collins, you've just told Senator Banks that you're going to give us the information that you have. You have failed to give us the information that you should have, or you do have, and you're declining to provide it. The numbers of specific categories of people whom you plan to fire, the contracts that you have canceled or that you plan to cancel, I'm going to ask you to provide that information in written form. I'm not going to get into an argument with you here, but just so you understand, I think that a good portion of the questions that you've been asked, frankly, you just haven't answered. And I'm hoping that you will provide those answers. Let me tell you one fact that I think we do know, and that is that your goal is to fire 15% of the VA workforce. You've said it again and again and again. I'm going to ask that a list of your quotes be put into the record, most recently to the Arizona Public Media, AZPM, on May 1, that, quote, I said there was a goal of 15%, which if you do the math is about 80,000. What I take away is you've got a goal of slashing 15% of the workforce come hell or high water, and you're going to figure out whom to fire as you go along. And that means frontline people who have been hired among those 50 or 80,000 people. And I have a list right here, which I'm also going to ask be entered in the record. They're numbers. They're real people. We're talking about, for example, 18,000 registered nurses and 5,000 social workers. Those are increases of 20 and 25%. Those are frontline people who've been hired. The total number is approximately 17% increase in the VA workforce. They are schedulers, physicians, police, psychologists, registered nurses, social workers, and 31% of them are VBA. You fire those people. Your goal is to fire 15% of the total workforce. They're among them. You're going to lose quality. You're going to lose time. There's no way around it. Now, I welcome your commitment that the savings, you just told Senator Banks, will go into care for our veterans, but that's not what you said on April 17th. You said that, quote, that'll be up to the president. Now, I don't know which is true, but I hope that the savings will go into caring for veterans. But is that your commitment now?
I think, one, I would like to see the context of that quote and where it was actually put. I think the issue here today is look, Senator, I think this is where we got. It's not right to stand here today, because I actually think there was a quote from others, and I won't say you specifically, but there's been others. It says, we're going to take 15% of doctors, 15% of nurses, 15% of mental health. That's just wrong. It's almost cruel.
It would be cruel. It would be cruel if it happened.
It's not happening.
Let me just...
By even repeating it, though, you're letting my workforce know, which are going through a process. If you were going to reorganize your office Would you just stand up in a staff meeting today and say, here's the 16 people we're discussing right now?
These are your words. These are your words in Tucson on April 30th.
Okay.
In KOLD News, April 28th. Script News, April 21. Spectrum, local news, April 9th. Detroit Free Press, April 1. Collins told the veterans that cutting 80,000 people from the department is a goal. On April
what are
9th,
we doing
first
here,
off,
Senator? I've admitted that
15% is
here
a goal.
I've admitted that
Let me
here
just go
today.
on, because the record is there.
It is. Nobody's denying you, Senator. I'm not sure the point you're trying to make, because I have said it is a goal, but I've also said it may not actually get to that number. It is what the process we're going through, and I'm not going to work out a process in front of a committee or anywhere else in which we're still in the deliberative process, because at the end of the day, with 470,000 workforce,
the goal
that
is a
incompetence.
dodge
That is
goal.
malpractice for me to do that in front of a committee. I'm not going to scare people, but I've also made the commitment that we're going to make sure that our health care is provided for, that our people are getting their disability benefits, and what we're seeing right now, whether you agree with the numbers or not, those failed when we added billions of dollars and thousands of employees. That's the part we can't get away from. And I'm willing to work with you in any way to do that.
You responded to Senator Sullivan's question about capping certain attorneys' fees for the Camp Lejeune victims. Are you aware of the Ensuring Justice for Camp Lejeune Victims Act that Senator Tillis and I have offered to put caps on attorneys' fees?
No, but it should have come a long time ago. I don't know what took so long.
Well, will you support our legislation?
I haven't seen the legislation, sir. I don't comment on things I've not read.
Well, instead of just putting out a
Senator
scam,
Sullivan on it?
instead of putting,
I was just curious, why wouldn't Senator Sullivan be on that bill?
you know what?
I'm just curious. Because, I mean, it would help me out, because we've actually seen this play out, and
Well,
I'm not going to let the veterans be duped into paying 70%.
I don't. Maybe you can talk to Senator Sullivan and he'll join the bill. But I'm asking for your support.
You please, I will take a look at your bill and see what we can do.
You're
I'll be
not aware
happy.
of it?
Excuse me?
You're doing a scam alert. I would suggest that maybe the way to really help veterans is to support
Are
legislation
you
to put
denying
caps on it.
that this is happening? Because if not, I mean, I have
The
paperwork
reason-
here. You're asking
you
me to
know-
support a bill that I've never read, sir, and that's just not fair.
I'm going
I'll
to
be
take a
happy
little
to
more
read your
time
bill.
because he seems to feel that he's asking the questions here. I'm happy to continue the conversation on this
Senator, let me
point.
see if I can sum this up. I think the Secretary has said he will take a look at the bill.
Yes.
Yeah.
And it's a bill that you don't know anything about, so you can't say whether you're for it. And Senator Blumenthal is happy to have your support after you look at it.
Correct.
Well
Thank
said,
you.
Mr. Chairman.
Thank you.
The chairman
Let
cut
me
through.
ask
Thank
you, Secretary Collins, I just have a couple of quick questions for you. Will you commit to provide privacy for telehealth professionals doing mental health care?
We have already done that, sir. Anything on our return to work policy, if they're actually put in a position where they do not have privacy, it's against the policy of return to work.
Do you
and they will be
deny
made-
the accuracy of the New York Times?
Oh, very much
report?
so. And I'll be happy to provide you everything. They were contacted. Everything that what it showed is that our systems were working. And when anything that they actually reported, by the way, we asked for veterans where care had been affected by that. They could not produce a single one. In fact, the New York Times even produced of overworked, crowded conditions. They sent our press people to empty rooms. So yes, I do deny it.
You deny it. Will you
Take a look at
provide us a factual refutation of it, not just?
We can, and we also did it. I think we're actually putting that on social media today. So yes, we go line by line. I take every one of these seriously, sir. I take every one of them seriously. ProPublica, you mentioned it earlier, New York Times, and yet we answered them one by one by one, and I have the email chains with the reporters that they choose to ignore. That's what we get.
Well, I welcome that you are committed to providing privacy and that you will provide a line-by-line refutation of the
We
New
always
York
have been,
Times.
sir.
Will you do the same with ProPublica?
We have that as well.
Let me ask you, have research contracts been canceled or frozen?
Research contracts are right now under the ones that are continuing are still continuing. If they were run out, then we're on a 9-day policy to consider where they need to be continued or not.
Is that a yes?
I mean, I can't answer your question any better than that. The continuation of contracts are happening right now. Research, there was some, by the way, as you well know, that they do run out at a 3-year cycle. We've actually held on to
So
those
you
right
haven't
now.
canceled any?
No, not at this point, no. Not that I'm aware of in that situation. If you want to provide something, we'll be happy to look at it.
Have you frozen any? In other words, before the expiration of the 3 years?
That I would have to look at. I don't believe so, because that's one of the reasons why we put the 90-day pause in.
Mr. Secretary, is Medicaid important to veterans?
Give me the context, Senator. I mean, it's
Well,
important for
do
anyone.
veterans
Yeah.
take advantage of the Medicaid program?
That's a conversation that's been going on for a while now concerning the Medicaid Advantage plans and the ones that are.
No, I'm
the
talking
discussion.
about Medicaid, not Medicare Advantage.
Okay, I'm sorry. I'll have to. I mean, I'm
You
not
don't
sure.
know
I'm not sure where we're going with
veterans-
this. As
You
far
don't
as
know veterans use Medicaid? You're not aware
yes,
of that fact?
yes. I mean, I understand what the Medicaid process. I'm not sure what your question is.
Well, my question is Medicaid important to veterans?
It's important to everyone who uses it.
Okay. Thank you, Mr. Chairman.
Senator Blumenthal, thank you. Just a couple of wrap-ups from me, Mr. Secretary. I wanted to give you the opportunity, and maybe just to educate me, what's the facts with the Veteran Crisis Hotline?
The facts on that were is the original, as we protected all those who actually answered the phone. And this was a concern that came up many times, because I started seeing in the press where it was accusations from the Hill and other places that we had actually fired the ones who were actually answering the phones. The answer to that, even from career folks, was that was not true. What we did have is we found there were some that were staff that were let go. When we immediately looked at that, I made the decision that we will make everybody back in, we'll protect the entire group, because we didn't want anybody to falsely accuse that we were not answering the lines.
And so today, is the crisis hotline any less or more, have more or less personnel than it did before this
I think it's
episode?
still at the same lines as it has
The
in the last
people
week.
that were let go, that you returned, came
They're
back?
back.
They're
Yes.
back?
Yes, they're back.
Okay. And then you answered my question about your interest in an IG and believe in its value. Would you also ask the White House for an IG for the department?
We already have.
Okay. That's my questions. Mr. Secretary, anything you want to, I often ask, this isn't just a treatment of you, the witnesses, if they have anything they want to clarify or correct.
No, look, I appreciate it, and I appreciate the ranking member. We have the same goals, I think all of us on this dais. We're going to disagree, and we're going to disagree about how to go about it. But there's several things, Mr. Chairman, that I'm not going to do, and I don't think it's fair to VA employees, and I don't think it's fair to veterans, to take things that are pre-decisional. Many of the things that have been discussed today were leaked memos designed to disrupt. They were designed to make the VA look bad or make veterans scared. I'm not going to do that. I'm going to challenge anyone that's going to hurt or scare a veteran or scare our employees. We're going to give you everything that we can at the time. I promise you that, and I continue to do that. We've had conversations, you and I have. But when we're doing something as large as we are at an organization as sensitive on this Hill, it would not be right for us to do that in public. It would not be right for us to just come out and say, here's everything that we got, and then have everybody scared, because in the end, it may not be the final decision. What we're going to do is come to the best possible decision we can for the veterans in this country, so that they have a VA system that actually works. And when we understand that, again, the VA has been an issue for a long time. We're trying to not make it an issue anymore. We're trying to get it to the point where it is doing what it's supposed to be doing and taking care of the veterans that are earned. And I appreciate the chance to be here today.
And I would just encourage you, it'd be a mistake if I didn't see if your crew can answer our team, both minority and majority staff's questions fully and promptly.
Yeah, can I say one other thing about that? Since I've been in about 90 days, we have answered from Ranking Member Blumenthal and SVAC minority alone, we have responded to 78 RFIs, 11 briefings, 9 technical assistance calls, 4 technical assistance are in progress, and many, many visits. We've also answered 19 letters from Senator Blumenthal and Chairman Moran, 68 letters and RFIs.
Mr.
Now,
Secretary,
you may not like the answers.
That was my mistake,
fine.
because we're going to start this conversation all over again now.
Yeah.
So
I just want to make clear.
We're going to do that.
Just so you don't feel, I mean, I'm just going to be really blunt. I think some of those responses are an insult to my intelligence and perhaps yours if you respond by giving us the kind of non-substantive answer that I think is inadequate, I'm not going to count it as a real response.
That's your prerogative, Senator. We'll continue to do our best to give you the
I'm asking for
information.
facts, not just acknowledgement of the questions. And I also would encourage you to avoid the use of non-disclosure agreements with employees so that we can get more facts from them.
All right. The hearing is about to conclude. I thank our committee members for their participation today. You had a full house. I thank the Secretary for his presence and his testimony today. The hearing record will remain open for 5 legislative days should any committee member wish to submit additional statements or questions for the record. Then, Mr. Secretary, I ask you and the department to respond to any question for the record that you may receive following today's hearing in a timely manner, which I guess will be decided by, I hope, me, if it's necessary. With that, our committee is adjourned.